meeting. Obviously, we are under some interesting circumstances right now, and our meeting tonight is to essentially complete our pre-COVID-19 business and move forward into the world that we're in today. We're going to start off with attendance. Before we do that, there are a couple of rules. I want to keep everybody on mute, and if you can keep yourself on mute unless you are called on, you can use the raise hand feature. I'm going to try my best to manage this. I've got a lot of different people who are on tonight. And as far as we may have a few people who are joining us intermittently through the meeting, who we may stop the meeting to allow them to speak. And I'm going to ask all the full board members to stay on at the end for an executive session where we have a personnel matter to discuss. With that, turn it over to Valerie. Valerie, do you want to start with attendance? And I'm going to, we may have to wait a second for people to unmute themselves as we go through the attendance.
Whoa. Whoa. Okay, can you guys hear me?
Yep.
All right. Susanna Aaron.
Here.
Keenberger.
Here.
Carter Booth.
Here.
Here. Katie Bardinaro. I thought I saw her on there. Anita Brandt.
She waved.
Anita did?
Yes.
Okay. Katie Bardinaro, just checking one more time.
Here.
Okay. I thought I saw your name. Okay.
Okay, thank you.
Amy Brenna. I know is on here.
Here.
Rich Cacapolo. Not yet. Ritu Chaudhry. Tom Connor is away. Sorry about that. Coral Dawson. Valerie De La Rosa, I am here. Doris Diether. Not yet. Robert Ely.
Here.
Thank you. Mara Fitzgerald.
Here.
Cormac Flynn.
Okay.
Is that not Cormac or is that Joe?
Sorry, that was me, Joe.
Okay, no worries. Joe, you're next was Rakoff. I heard you earlier.
Here.
Thank you. Bo Riccobono. Robin Rothstein.
Here.
Sandy Russo.
Here.
Okay. Rocio Sands.
Here.
Thank you. Scott Sartiano.
Here.
Shirley Secunda. I thought I saw her name as well.
Here.
Thank you. Kristen Shea.
Here.
Thank you. Frederica Siegel.
Here.
Georgia Silvera Siemens.
Here.
Thank you. Shirley Smith, Dr. Shirley Smith. Chenault Spence.
Here.
Thank you. Kathy Sullivan. Susan Wittenberg.
Here.
Thank you. Antony Wong.
Present.
Adam Zeldin.
Here.
Okay. Thanks.
Thank you, Valerie. I've got somebody with the cell phone number. The last numbers are 9390. Who is that?
Yes, it's Edma.
Oh, thank you, Ed.
Thanks, Ed. I'm going to put your name in there.
Thank you, Carter.
Great.
Okay. So to move on to the public session, we since we haven't quite figured out the technology, where the complexity of having the board members meet, the public session we're going to be conducting via emails sent in that we had requested earlier in our emails, our last 3 emails to the public. Dan is going to summarize. I think we got a few emails, correct?
Yeah, we got 2 emails. And just to go through the process, it's going to be as follows. If you're listening in from the public, please send an email to CB2 at info@cb2manhattan.org, which is on the emails we send out to you. Or you can always go to the website, and click the Contact Us link, which will direct your email testimony to Bob Gormley, and his email comes right up. So starting the public session, and Susan, please don't cut me off, but I don't think it's going to be 2 minutes. But anyway, my levity.
Oh, okay.
My stab at levity, anyway. So Jane Carey from the Whitney Museum writes, Dear Community Board 2, in the interest of protecting the well-being of our staff, volunteers, and visitors, the Whitney Museum decided to temporarily close the museum to the public and cancel all events beginning last Friday, March 13th at 5 p.m. Any further updates will be announced on our website and social media channels. In the coming weeks, we hope to share more ways to engage with the Whitney online. Right now, our collection can be accessed online along with videos and other material at whitney.org. And on a personal note, Jane writes, we at the Whitney often talk about being part of a family, and that has never rung more true than in these last few days. I have found great comfort speaking with colleagues, both internal and external. The conversations offer moments of solidarity and much-needed breaks from the fast-moving news and uncertainty we are all confronting. The village has always been a leader in showing how neighbors can support each other, and I am very proud to be a part of this community. If you'd like to reach out to Jane, you can reach her at jane_carey@whitney.org. That's the end of her testimony. And the second email and last email that we have is from Clive Morick regarding the Baby Brasa Sidewalk Cafe application. It's short, so I'm going to read it in full. Sirs, I object to the grant of a license. Reasons. Number one, applicant is a bad actor. CD2 records will reflect that from 2019. Two, space is not conducive to a sidewalk cafe. A, it is at the side of an enclosed sidewalk cafe and backed by a brick wall, which reflects patrons' chatter across the street to my building. The only way to serve patrons is through an open door from the enclosed sidewalk cafe, letting the loud music out to the atmosphere and across the street to my building. At the subcommittee meeting last week, the applicant agreed to put in a swing door, but the space is too narrow and it won't work. For 2 years, the loud music, which applicant uses to attract business, is not background music, has gone on past midnight and made life at my building intolerable. Granting this application will just continue the harassment. Clive Morick, 201 West 11th Street, written on March 16th. And with that email concludes the public session.
Okay, thank you, Dan. We're now going to have a motion to adopt the agenda. Can I have a motion, somebody motion to adopt the agenda?
Motion to adopt.
Seconded?
Seconded.
Okay, so the agenda is adopted. Then we're going to move on into the elected officials' reports. And I guess the easiest way to do this is if the elected official reps who are going to be giving the reports, if you could raise your hands, so to speak, which if you click on the Manage Participants or the Participants tab on the bottom of your page, go over to the right and under More, you should be able to raise your hand. I think actually, I think we're going to start tonight off with Assembly Member Deborah Glick. Are you with us, Deborah? I'm going to unmute you. I see you here.
We're all learning.
All right. Yes, we are. Thank you.
First of all, let me just say to everyone in the board that I and my entire staff, both upstate, downstate, wish everybody to stay safe. And, this is unprecedented. And in Albany, we passed a couple of bills, and we did so by having a very limited number of people in the chamber to debate. You had to announce in advance if you wanted to debate. And then in small groups, we arrived to vote and we watched everything on live stream. So it's, we're all working remotely, and we're all working to provide as much information as we have. We will continue to do probably every couple of days, because every day there are new challenges. The best news for folks who have had either a quarantine because they are infected or because they have been exposed, we passed legislation to assist them with either paid or unpaid leave, but guaranteeing their job. There's also, so we will have detailed information on that going out tomorrow. And the good news today for folks who have either lost a job or are laid off or have had their hours shortened and have a mortgage, the governor has gotten a 90-day forbearance for people. It doesn't mean that you'll have to pay double when we start back in some sense of normalcy, but it'll go on the back end of your mortgage. Evictions have been forestalled, as are foreclosures. The feds have done public housing, we have done rentals, we have done mortgages for those who are unable to pay. So there are, the governor's been clear that the city is not locking down, but we are all asked to stay home unless we're doing something like walking a dog or going out for a jog or doing shopping. So the whole point is to try to stop the spread. And you do that best by staying inside to the extent that you can. Special emergency services, working for the transit authority, obviously pharmacists, doctors, nurses, folks who are involved in food stores. All of those are viewed as essential jobs. And so we're all working from home. And school children are home, and it's a difficult and unusual time, but I do believe that, as FDR said a generation ago, the thing we have to fear the most is fear itself, and so I don't want people to be panicked. I've gotten innumerable calls or messages from friends and some constituents about one rumor or another. So we'll try to keep you with accurate information. And frankly, I think the governor, with whom I have not always agreed, has actually done an excellent job of clear, consistent messages to the public. So I want to thank you for holding this, and I will stop yakking and I will just listen for a while. Thanks so much.
Thank you very much, Assemblymember Glick. It's great to see you, and obviously you're doing a great job. And these are very different times. I don't think the last time I saw you, I'd think I'd be seeing you on the other end of a video conference. Thank you very much. Who else do we have who will be presenting from the elected officials? Can you guys use the raise your hand feature? I know. All right, here we go. Robert. Start off with you. You're right up at the top.
Hi, everyone. This is Robert Atterbury with Congressman Nadler's office. I am glad to see that everyone seems to be healthy, and we want to thank you all for continuing to move forward with this and keeping sort of our government and democracy functioning as we get through this, as the Assembly member said, sort of unprecedented crisis together and moving forward. A couple of announcements. Our office is at the moment, fully teleworking. So we are all working from our homes, but our phone system and our emails continue to work. We are sort of fully functional, as it were. If anyone needs assistance with a federal agency or guidance on resources, please don't hesitate to reach out. We have a pretty robust set of guidance for city, state, and federal resources, and we are happy to try to help make sure that people are getting connected in the right way. Today, the President signed the Families First Coronavirus Response Act. This was the House's bill. Provides about $8 billion in funding to rapidly expand testing capacity and ensure free testing and treatment for everyone who needs it. It provides nearly 87 million individuals with paid leave, and that would be funded by the government for up to 2 weeks at full pay. It expands food assistance, including SNAP and WIC. It expands unemployment insurance. And in addition to that $8 billion, will provide New York State with approximately $6.7 billion in expanded Medicaid funding, and that's sort of annualized for the year. We are already hard at work on the next relief bill. We know that the Families First bill does not meet everybody's needs. We in the House face a very difficult choice of either moving quickly with the consent of Republicans or not at all. And we wanted to make sure that we were getting these funds to states and individuals as quickly as possible. A couple of things that we are actively working on is to make sure that we're providing support for contract, freelance, gig workers. That involves a lot of artists, a lot of content makers, a lot of independent professionals who are not covered under unemployment insurance. And the Congressman is seeking payment of about $2,000 a month for every American for the next, while we are in the health crisis, as just a direct payment to people. We also want to make sure that we are providing support for small businesses and nonprofits, both of which are deeply strained under this. With asking folks to shutter their doors, nonprofits to theaters to stay dark, small businesses to have their customers stay away, we need to make sure that we are unlocking beyond the loans that are available. Today, the Small Business Administration authorized New York State's application for an economic disaster, which allows for emergency loans to be made. However, they are loans, and we are fighting to make sure we're getting some direct support. We also need to we're looking for support for renters in addition to those with their mortgages, people with student loans, trying to backfill funding for mass transit. On Tuesday, just so folks know, there were about 4 million fewer rides taken on the MTA. That's 4 million fewer payments that went in. And we've heard from a number of constituents, including some folks in CB2, that are stranded abroad because of commercial flight cancellations, and we want to make sure that we are providing funding for the State Department to be able to repatriate those stranded abroad. Again, please don't hesitate if you have questions. We are here, we are functional, and I'm turning it over back to Carter. Thank you.
I scale. Right on. No,
because to avoid going facilities to try
I scale brewer. Does that work?
they may or may not have.
Never mind.
Because we want to avoid people overrunning the medical facilities.
Gail, you're on. If you're with us.
Yep, I got two issues. One is I have I have board 9 on also. The issue is we are obviously not in the office, but some people go in every once in a while. The second issue is that we have this daily newsletter, which I think everybody gets, which I think has been quite helpful. We're also trying something very strange with the Garment Center. We're trying to get the Garment Center to sew, and turns out that in Wisconsin, DuPont has thousands of, I would say, thousands and thousands of reams of surgical garment material, raw material. So we're hopefully by the end of tomorrow, we'll know if that's available. And then it could come to New York. The Garment Center thinks they can do about 25,000 garments and masks very, very quickly. So that's something, because of my interest in the Garment Center, hopefully will happen.
Just lost you, Gail. Are you there?
Can you hear me now?
Yes, we can.
Okay. So we're flooded with calls from seniors. Fresh Direct is going to start on Tuesday, delivering 400 meals a day. We'll figure it out between uptown and downtown. But between now and then, we have a lot of seniors who either can't get to the nearest senior center, but certainly Meals on Wheels and other Live On have been incredibly helpful in trying to get us what we need, and I really appreciate it. We also have, just the usual amount of small businesses. Tomorrow, the payroll taxes are due, and I understand from the mayor directly that one can get an extension. The hotels want 120 days of extension. They are really hurting. And of course we have, and I'd love to get opinion, construction. The issue in San Francisco, even with a lockdown, construction continues. The issue that the mayor said is that they're outdoors. On the other hand, they are close to each other. So that whole construction issue comes up often. So from our perspective, it's the seniors who are trying to get that early morning time when they can shop. It's the construction question, and of course, massive amounts of questions about small business, which I'm sure you're getting. And congratulations on your technology. Thank you.
Great. Thank you very much, Gail. And let's see. And thank you, Gail, for your office's support. We've been doing a lot of work with the Manhattan Borough President's Office. And next I see I've got Claudia. Claudia, are you with us?
Yes, I think everyone hearing this okay?
Yes.
Got it. So good evening, everyone. This is Claudia from Assemblymember News Office. Going to keep this brief as usual. Quick note, our office has fully transitioned to working remotely. We are still accessible through our email and our office line for any questions and concerns. For updates, last week, the Assemblymember attended one of our final press conferences to discuss some of our concerns for COVID-19 in our community. A number of points that we echoed at that time was the ongoing xenophobia and incidents towards the Asian Americans across the board in the city. It is absolutely harmful and unacceptable, and the Assemblymember calls for the community to continue to stand together and remain educated on COVID-19 and keep an eye out for all the misinformation that is circulating. It is kind of wild these days to see what comes up on Twitter and gets spread out very quickly. In terms of other work, we have done 2 letters to Governor Cuomo. One was for at-home testing kits for COVID-19. This is to allow for more rapid testing while also lightening the load on our healthcare workers. We're also hoping to minimize the amount of exposure when individuals are coming out for their testing. This would allow for them to do it at the comfort of their home and then have that arranged to be sent towards a testing center. And then our second letter was a priority COVID-19 testing for 9/11 responders and survivors. Most of these folks have already pre-existing conditions or the side effects from the time, and we are asking for priority testing for them. And one of our final letters we did for NYCHA, going to their CEO, asking for a very in-depth and thorough cleaning protocol for all the buildings. This is on behalf of all of the residents that have told us that they have not seen much of an increase in terms of the cleaning, especially in the high traffic areas. So that was one of our letters calling for them to really be fully aware of the areas that need constant cleaning, where people are touching a lot or just brushing past all of that. And that is as far as what we've done so far, and we will continue to work along with the community as we go into very new uncertainty, I would say. And finally, from our office, we're wishing everyone well, you and your family the best, and please have a good night.
Thank you. And got Luke Wolf.
Hi, everybody. Luke Wolf here from City Comptroller Scott Stringer's office. I hope that you and your families and your neighbors are all staying safe and healthy and practicing your best social distancing during this time. I want to speak for a moment about what we're doing to make sure the city's economy is protected and the workers and small businesses who are the most vulnerable right now are protected during this time. Like the other government offices, we are working from home, but we are working around the clock to make sure that all the services and the economic supports that we provide are still fully ongoing. Our pension team is working hard to make sure all of our retirees are still getting their checks on time, and our investment strategy is still steered toward long-term success. Our budget teams constantly assessing the impact on the city's economy. We've rushed over $140 million of emergency contracts through to make sure that the city can distribute all the funds that they need to make sure that iPads are provided to school kids and all the other emergency services are provided. And we're also making sure that nonprofits throughout the city are not being penalized for not missing their deliverables, as many of them cannot stay open during this time. We've also called for a number of proposals to be enacted at the city and state level, or at the company level, to make sure that small businesses and families and workers are able to survive this downturn. The first, we have asked for all the credit score companies to not count any missed payments against individuals' credit scores, as they might not be collecting their normal paycheck during this time, or may not be able to make their normal payments during this time. And we want them to have a suspension on negative impacts of credit scores as a result of COVID-19. We've also asked for a 10% delivery commission cap for companies like Grubhub and Uber Eats, so that both restaurants and families who are ordering in are not just beholden to whatever fees they want to charge, as restaurants and their normal ways of getting food are not open or accessible right now. Like some of the other electeds, we would like to see a deferment on the sales tax payments due March 20th tomorrow. And we want to see businesses have a waiver on some of the fines and fees which are not health related in the coming months as well. We know that many of them are struggling or forced to close right now. Our priority is making sure that them and their workers are protected. And that also goes for the arts and creative communities and the independent gig workers who right now might not have their normal income stream during this time. So we also lastly want to thank all of our state and federal partners who are working so hard and advocating for New Yorkers. And our office is once again open round the clock, and I'm available with anything that you guys might need.
Thank you. And next up, we have Senator Brad Hoylman. Brad, I'm going to unmute you if that's all right.
Yes, thank you.
All right, you're unmuted.
Thank you. First, I have to just one of the things about Zoom, which I find most fascinating, are people's backgrounds. And has somebody mentioned Brian? I'm sure they have already, that he's got this ocean in the background. I'm not the only one who's noticed this, right?
I did notice it too.
Okay.
I was going to nominate him for best background.
Okay. I'm assuming it's a blue screen, or he's having a really good time somewhere. I'm not sure.
It's very annoying.
Yeah. Is he really there?
Brian?
Okay, maybe he is. I thought it was a green screen, rather.
You can create your own backgrounds.
Yeah, that's what I thought. I figured as much. But thank you to the borough president and Bob and Carter for utilizing this kind of technology. You know, with that in mind, I had introduced a bill a week ago that would allow this kind of teleconferencing under the New York State open meetings laws. So we want to make sure that community boards are not, caught in the void here. The governor issued an executive order following my introduction of the bill to allow this, but I still think it should be done automatically whenever there's a state of emergency declared. So we'll continue to press for that bill when we have time. Obviously, there's a lot moving very quickly, hour by hour, and I know that the borough president mentioned it's signing up for text alerts at 692-692, or calling the New York State COVID-19 hotline, which is available on my website for more information. The state legislature has been meeting. I just came back from Albany. That's why I'm a little bit late, just literally walked in the door. I was one of only one other person on the train in my train car. It's eerie up there. The streets are empty. I don't know if you had to take the subway, but it's obviously empty because people are following, good sense and staying home when they can. So I really appreciate that. Yesterday, the legislature passed comprehensive paid sick leave for those subject to a mandatory or precautionary order of quarantine. And as the economic impact of the virus becomes more evident to us, I'm calling on all levels of government to support a restaurant rescue plan, a small business bailout, and a wage worker and gig worker support fund so that we can save as many jobs as possible. We're really going to have to step up with both federal and state support to ensure that the people who are hurt most at the bottom of the income ladder are protected. It's going to require some really difficult choices. We're doing that right now in Albany. I hope that we look at how to raise revenues moving forward. Obviously, the economy is in a precarious position, so we have to take that in consideration. Two, as the cost of face masks and other consumer medical goods become exorbitant, I know any of us who've walked into, a bodega in our neighborhood has seen face masks for $30 a pop or sanitizer for $25 for a small bottle. I introduced legislation that would set a benchmark on price gouging, meaning that during a state of emergency, you couldn't raise a product price that is a consumer medical item like sanitizer, face masks, gauze, more than 10% of its retail price before the state of emergency was declared. It's the same standard we have in states like New Jersey and California and the District of Columbia. I'm hoping we can get it in New York because we really need that bright line rule, not just to make it better for consumers, but so that retailers know if they're getting gouged by their distributor, for example. The bill would also give the Attorney General new powers to go after price gougers all the way up the supply chain. So I'm hopeful that we can pass that bill as soon as possible, even though we've got a lot on our plate, obviously. I signed a letter tonight with my colleagues. I'm the chair of the Senate Judiciary Committee that would place a pause on all statutes, would call that we place a pause on all statutes of limitations in both civil and criminal matters. Obviously, if you're a litigant or you're reporting you're a victim of a crime, for example, this period, it should not be counted against you in terms of statutes of limitation. In the same vein, I'm pressing that we put a pause on the year look-back window that we passed this year for survivors of child sexual abuse. So I hope to see the governor issue an executive order on this. The Attorney General, Tish James, backed up our call for a pause on statute of limitations today with her own call. So I was very pleased about that. I'd like to invite everyone to our second town hall. We had a virtual town hall on Sunday with Assemblywoman Linda Rosenthal, and we had a few infectious disease specialists. It was very interesting, two from Rockefeller University and one from Columbia, and they asked, on Facebook, we had a lot of questions, including some very, very New Yorker questions like, is takeout still safe? Things like that we all are asking ourselves, every day. That'll be this Sunday, May 22nd at 8 p.m. It'll be also on Zoom. You can join on my or Assemblywoman Linda Rosenthal's Facebook page and ask questions. We're working really hard on constituent services. Our office is closed, but one of the weird kind of results of this kind of virtual world is that we've been so focused on constituents because and Jacob can back this up, he's on here, because they've been contacting us by email and by telephone. We've been really on top of those calls. I hope you've seen some of that result if you've contacted my office, and my team has just been doing a fantastic job. Just today, we got an enormous donation of face masks from a constituent. And we're organizing volunteers through our website to volunteer for groups like God's Love We Deliver and Visiting Neighbors. So please join if you have time to volunteer or the ability to volunteer. The other thing is you should spread the word for retired medical professionals. The governor's office is seeking those individuals. And you can go to the governor's webpage, which you can find on my webpage if you know of someone who has medical experience. They're looking to bring those folks out of retirement because we're going to probably need them in the next weeks and months ahead. But this is showing me really, truly how strong our community is, and I'm certain we're going to come out all the better for it. So I wanted to thank all of my colleagues in government and the community board for all the work you've done already. It is a long road ahead. But with all of our collective efforts, we'll make it through. Thank you.
Thank you, Brad. And thank you for a really great town hall meeting, your virtual town hall on Sunday. I really enjoyed watching that, and it was very informative. You're right, New Yorkers have very specific questions that we don't get to read about in the national press, like what's up with the park bench, and that was, and that's really what people are interested in knowing. Thank you. Did I have a couple of questions? Am I seeing that, Robin?
Yeah, I just had one question for Robert. He's still there?
Okay, let's hold off and just if anybody's got some questions for Brad.
I have a question. I have a couple questions for Brad. This is Ritu.
Hi, Ritu.
Hi there. Two things with respect to healthcare. Number one is, are there plans to loosen the requirements, the HIPAA requirements for Medicaid recipients in order to allow broader appointments through telephone and video conferencing?
I've heard that mentioned. I have not seen anything in an executive order, but that's, I know HIPAA is also a federal issue, but we'll follow up and see what the state is recommending to the feds in connection with that, but it's a really good point.
So that would definitely expand the ability of New Yorkers to receive health care. The other issue is also
if I could just say
of medicine. Oh, sorry.
If I could just jump in there, I do believe that the feds have indicated that they are going to loosen some of those restrictions in order to make telemedicine much more widely available.
Just FYI, HHS has already submitted that. So they are allowing that. CMS has also issued a ruling with respect to HIPAA and for Medicare recipients, but it has not been expanded to Medicaid. And I'm just saying
we'll look into that.
Yeah.
That would be great for lower income New Yorkers. The second thing that you may want to look at is to expand the offerings for healthcare by looking at the corporate practice of medicine. And Brad, I was going to raise that issue with you at a later point, but I just want to put a little bookmark there.
Okay. And can you further explain that?
So right now there's a prohibition. You cannot practice, you cannot organize medical practices without having a medical practitioner be the owner. And that really kind of narrows, in many cases, the ability for practitioners to be all things, to be billers, to be doctors, to be counselors.
Well, I think Assemblywoman Glick is an expert in this area. I know she.
And we're going to have a presentation from Lennox Health Greenwich Village in a few minutes, so they'll probably be able to jump in with some more details on not on the legislation side, but on sort of the technicalities of some of those different areas. Do we have any other questions for Brad?
I have a question. It's really a question for all the electeds. I don't know if this has changed since yesterday, but Greenwich House is initiating a program where they call all of their members a couple of times a week just to make sure that everyone is okay. But their list is pretty small because their membership is pretty small, and they would be enormously helped by any contacts that you guys are able to share with them, because the hope would be that we then find a cajillion volunteers who just each take on a number of seniors and just check in with them, and that really, can be life-saving. So it's just a nudge. You might have heard from Darren Block and Greenwich House already, but I just wanted to nudge you guys.
Yes, I've heard from Darren Block. We've collected a list of 150 villagers and others who are signing up to do this kind of work. So I know we can reach out to Darren Block if we haven't already. I know Jacob was talking to him, and I bet Deborah's and Gail and our other colleagues have resources.
Yeah, I think I'm checking with Tracy, but I think we have had a call to us, and we're going to go through our list, and we'll also put something in our outreach so that people can let us know about neighbors that they may think are isolated or for whom they don't think are connected to a senior center.
All right. I just want to interrupt for a second. David, you're sharing the agenda with all of us. If you could exit out of that, sharing your screen, please. So you need to go down to the bottom of your screen and click stop sharing.
Oh, by the way, I see the ELA, something, a mention of the ELA. Could I ask you something, Woman Glenn? Have you heard whether SED's delaying the ELA this year yet?
I really, I don't think that at the moment they have issued anything, in part because we have no idea what the timeline is going to be for anybody going back into schools, and whether or not there is a mechanism for them to administer the test remotely. So I at the moment, I haven't heard anything definitive. I just suspect that it is unlikely to take place, but we'll check on that too.
All right, thanks guys. We're gonna move on to the next elected officials report from Eric Botcher from Speaker Corey Johnson's office. Eric.
Unmute. Hi, everyone. I'll be very quick. Congratulations to Community Board 2 for doing this broadcast. This is history being made tonight. So congratulations to Carter and CB2. This is the beginning of a new era in Community Board meetings. You all, if you've received any emails from Corey or been watching the news, you've been seeing what he's been up to with this $12 billion relief plan he proposed today. We're urging the city to make the right decisions as we go along. I'll talk just very briefly today about our efforts locally. As Brad said, constituent services are paramount this week. We've been receiving a very high volume of calls, and our staff, Patrice Comerford, who's on here, they've just been doing a fantastic job working remotely and working with so many constituents who are reaching out with some really heartbreaking stories of people who are just going through an incredibly tough time, losing their incomes overnight. We've been in touch with many small businesses, Stonewall Inn, Tea and Sympathy, Village Den, Lilac Chocolates. They're all going to need a lot of help. So we're going to be working very closely with them in the weeks and months ahead. We've also been getting a lot of calls, incredibly inspiring calls from folks reaching out, wanting to help. Hotel purveyors offering hotel rooms to medical professionals, catering companies offering their kitchens, and we're connecting them with the right folks in the city to help with that. We're working with a lot of our local nonprofits who are going to be facing some real budget issues. A lot of the work we've been doing the last week has been working with them on their city council discretionary funds, because a lot of them just simply aren't going to be able to meet the obligations of their council discretionary awards anymore. So we're going to have to really work closely with them to help them through this process. And then the normal business is going on. We're still taking care of all the issues that we were facing before. We have a call tomorrow morning with the Parks Department about Little Red Square. The work at Little Red Square on 6th Avenue has been going on for way too long. Those businesses need it to end. So that kind of stuff, we're pushing ahead. But I want to thank Community Board 2 and all the elected officials, Brad, Deborah, Gail, Jerry's office, everyone, for working so amazingly on this week. Thank you very much.
Thanks, Eric. And thank you guys for all of your work. And Patrice, who I spoke with earlier today, is also on with us. And also have Eliana Cohen, are you with us?
Yes, hi. Hi, everyone. I hope everyone's feeling okay and getting some fresh air with social distancing still in mind. I'll be very, very quick. We've been doing a ton of outreach with a focus on senior centers, naturally occurring retirement communities, youth organizations, nonprofits, small businesses. Like everyone has been saying, we've heard from a lot of folks in the community, and we're doing our best to make sure we're listening to what folks are saying. One thing that I think someone brought up earlier that we're looking into right now is around the telehealth calls and making sure that those are still getting covered. But yeah, I mean, we are fully remote now, but please feel free to reach out. I'm just going to broadcast my personal cell phone number out there really quickly. So if you want to reach me, we're perhaps even more accessible than usual because we are all using our cell phones. So it's 802-825-1755. If anyone needs to connect with our office, we're using our regular line as well, but that's me directly, and I'm happy to chat with anyone about their thoughts or anything that's going on. Thanks.
Thank you. And I've also got Anthony Drummond from Councilmember Chin's office was having some trouble getting in, but he just sent me an email and said that on behalf of their office, he wanted to let us all know that Councilmember Chin's staff is working from home as they're all trying to deal with the COVID-19 issues. And if anybody needs to get in touch with them for constituent services, you can email him directly at adrummond@council.nyc.gov or call their office directly, or his cell phone, which is 332-877-5374. And if you need that information, you can email info@cb2manhattan.org or directly the link to Bob Gormley, our district manager, on our homepage.
Let me give it right over to Alex Hellinger, who's the Executive Director for Lennox Health Greenwich Village.
Thank you, Wayne. Thank you very much. And thank you for giving us this chance just to come and talk to the board again. I would like to also say hi to Eric, to Deborah, Brad, Gail. You have all been really, really supportive of us over the last 6 years. So thank you for all of that. I will just say on the telemedicine front, a few comments I heard, I'll just give you our perspective on it. We have been using telemedicine now for quite some time. We use it within the hospital system for telepsychiatry, telestroke, tele-ICU, even telehospitalists now. And it is beginning to move into the private sector. So any of those government regulations that can be loosened to help that would be very, very helpful. But times like this, where people really want telemedicine, they don't want to go out of their homes and go to the doctor's office, it's becoming more and more important. So we're on that front. We're fully in agreement. I had a few questions here, so I think I'm going to go down some of these questions, and then I'm going to hand it off to Dr. Levy for some clinical updates on COVID-19. But just to go through some specific questions that were sent to us. They were asking about shortages for the tests, the COVID tests. This is something that's brand new. So I think we have been increasing our test capacity. So Core Lab, you may have heard that. You may have heard Core Lab on the news a couple of times. They're our very large laboratory in Long Island. And they started, their initial ability to do tests was about 70 a day. Recently, that went up to 200 and 300 a day. Then 500, and yesterday they did over 600, and they're expecting to do over 1,000 within the next week or so. So the ability to do the tests in rapid fashion is moving. First, it was a completely manual process. It's moving to a semi-automated and then a fully automated process. So that will ramp up. The limiting factor may be the reagents and some of the chemicals that they use, because without those, they can't do the test. So from what I'm hearing from the labs, that's more of a struggle than actually making the test happen very, very quickly. So they are working with that. Everybody is working on it, and it's becoming quicker and quicker. But we do have a long road ahead for sure. There was also a question about the drive-through tests. So currently with the drive-through test, there's 2 in Long Island. I believe there's 1 in Staten Island that just was up and running, I think today. We are becoming involved with those. We've been involved from the onset. Even with those, there is a number to call. So the two on Long Island, and I can give you the number. I can email a bunch of different things after this this meeting. But there's a number to call. It's not a test like you saw in Japan where anybody can go. Essentially, they're going to ask if you're symptomatic, if you're having fever and cough and short of breath. And those are the folks that generally they're going to test. That test, from what I'm hearing, you have to make an appointment, and that appointment, you can go there in about 5 to 7 days. And then there is a return on that test anywhere from 2 to 5 or more days. So those are ramping up as well, but they're still struggling a bit to keep up with the demand. But even as the test, by the way, as we're able to do more and more tests, there are more and more people that are being tested. So the number of supply and demand is a bit challenging here. But again, everything is moving pretty quickly. There was a question about bringing a relative into the hospital and if they would be exposed to COVID-19. So currently our policy and what's been sent down from the state and the government is really there should be nobody accompanying patients unless it's absolutely necessary. So if it's just for comfort, things like this, like Zoom, Skype would probably be better, but we are trying to seriously limit the amount of folks that are coming into the facilities unless they truly need to be here. So we're doing that. Of course, if it's a minor, if it's an end-of-life situation or something like that, of course, we do allow people to come in, but we're really strongly suggesting that if they're not necessary, that they do not come in. And they do, again, something like this as we're in this age of technology. So the question as well of where do patients go from here? Do they all go to Lenox Hill Hospital? They do not. If you have your doctor in Mount Sinai or NYU, we would certainly send you there if there's an accepting doctor and there is bed capacity there. As far as Lenox Hill Hospital, they're a licensed 632 beds, currently operating at 450, and they have 48 ICU beds. So with what is happening now, we have been going through surge plans for all of Northwell, all of the 23 hospitals and hundreds of ambulatory practices, and we're looking for alternate site locations. Even in Greenwich Village, we're looking at certain spaces that may be used for overflow, and we've been going through this for the last 2 weeks, and we've identified many places. So we're very well prepared for this, and we're preparing for any potential outcome and where this is going. We know we have a long road, but we are really well positioned to take care of it.
Okay, thank you. Wayne, did you want to add anything else?
I do want Dr. Levy to speak. But I did want to say one more thing before Dr. Levy speaks. There was a question of information that could be sent. So I can send you all of our Twitter accounts, our Instagrams, Facebook. There's also a digital center, resource center for COVID-19 that has all of the latest up-to-date with the epidemiologist weighing in. So it sort of puts it all in one place. But I will send that. Wayne, I think you know where to send it. We'll get it to you and you can get it out to everybody. So Dr. Levy, if you would, just maybe talk about the clinical.
Sure. Can everybody hear me?
Yes.
Can you guys see me as well?
We can. Yes.
Excellent. So just to echo what Alex said, thank you to Community Board 2 and all the members for, giving us the opportunity to speak to you guys tonight. This is certainly a unique situation, and I want to echo what Alex said, that we have been preparing for this. So we've been running mock drills, we've been doing surge planning. We're sort of ready if this does end up ramping up, which many folks think that it may. So from the clinical front, our RER is still open. We're going to continue to remain open. We're 24/7. We're fully staffed. We've been working on staffing contingency plans so that if our healthcare workers do get sick, we're able to pull resources from our vast system to make sure that we're operating at 100% capacity. So to the sort of clinical front, symptoms, everyone's got access to the CDC website. I find their information to be very, very accurate, and it is updated on a regular basis. So it's sort of hard to discern, COVID-19 from the flu. Some are saying some of the symptoms can be a little bit different, a different feeling of a sore throat, more nasal congestion than you would get with a common cold. But still, folks are getting fevers and chills and body aches and some gastrointestinal symptoms as well. And so the next natural follow-up question is, what do you do? So what do you do if you're feeling sick? And I think there should be a decision that everyone has a threshold for when they need to seek medical care. For mild symptoms, we're really asking folks to try to manage at home. So hydrate, rest. If you're having a fever, you can take ibuprofen or Tylenol, as long as there's no contraindications to doing that. But if you start feeling significant chest pain, you're having trouble breathing, you're getting out of breath, getting up from a seated position or walking around your apartment, those could be signs that there may be a more serious infection going on. And, we would encourage you to come and get evaluated. Now, not everybody that comes into the emergency department at this point we're able to test. And sort of echoing what Alex had said, as our system, not only Core Lab, we're also partnering with LabCorp and Quest and some other private labs. As our capabilities to test expand, we'll be able to test more and more people. However, at this point, we're really only testing people who are symptomatic. So unfortunately, there's not enough tests at this point to test everybody. So the sick people are going to get tested for sure, and they're even trying to discern whose labs get processed first. So on the inpatient side, it's ever so important that we get that information back so that we can release specialty beds for patients who are indeed positive and release those beds for patients who are negative. The turnaround time that we're telling our patients, so for a majority of folks who are getting sent home and discharged and told to manage at home despite getting tested for COVID-19, the turnaround time right now is between 5 to 7 days. And again, as the testing capacity ramps up, we hope that that turnaround time will become shorter. What I would encourage people to do, and I'm telling this to my folks who don't live here, they live in South Florida, is to have a plan. Talk to your primary care doctor, talk to your community doctor, find out if they do testing in their office. We do have an urgent care organization called Go Health. They have a bunch of locations, one in Greenwich Village, one in Chelsea, a few on the east side, and they're able to process tests as well. So we're trying to find the right balance in terms of keeping the right people in the hospital and making sure that the folks who are sick have other mechanisms to get tested. So that would be the take-home advice I have for the folks on the call tonight, is that everyone should sort of have a contingency plan and do a little bit of research on their own, so that if they do feel sick and potentially not sick enough to go to the hospital, that they at least have alternative mechanisms to get tested.
Okay, great. I think I see a few questions here. Wayne, do you want to add anything in before we take a couple questions? I think you're muted. Hold on a second. I'll unmute you, or if you
unmute. Great. Oh no, like other organizations, some of our non-essential staff are working from home. We are fully medically staffed, 24/7, as Dr. Levy said. So people should be comforted in that. Other than that, I think we should just take some questions.
All right, Matt Metzger, I see you on with your hand raised. Gonna unmute you, all right? Yep.
Oh, I'm sorry.
Yep, go ahead.
Can you hear me?
Yes.
Beautiful. First of all, thank you guys for everything that you are doing. I'm sure this is an incredibly stressful and busy time. So I can certainly understand the need to project calm and, that it is under control, but I guess my concern is that there's no physical way to know what is in store for us. And at 25% infection and 1% case fatality rate, there's no physical way anybody could be prepared for that. So I guess, are there serious discussions about contingency plans where if you guys happen to be wrong and you aren't well prepared, or simply force majeure, like not your fault, what you guys are going to do?
Yeah, that's an excellent question. So they're certainly planning for different stages of what may happen in terms of supplies, in terms of staffing, in terms of capacity. So This is happening on a system level, on a local and site level, like Lennox Health Greenwich Village, and certainly on a state and federal level. So I can only speak to what we're sort of Northwell Health and our specific site is planning. So there are certainly ongoing conversations on a daily basis about our surge and capacity planning. So I guess the short answer is yes, we are planning for every iteration of what may happen.
Yeah, and I'll just add, we've actually looked in the building here. We had a team today here of physicians, ACPs, nurses, IT, of how do we stand up additional units. So the fortunate part of being part of Northwell is there's 23 hospitals. There's a lot of really bright minds in this organization, and we've been putting it all together. So we feel we're really well positioned to handle this. But yeah, we think we're in for a long road, and we are certainly preparing for that.
Okay. Thank you for your question, Mr. Metzger. David, I see you up at the top of the list there.
Thank you. This has been very helpful, Alex and Dr. Levy. This is David Gruber speaking. I'd like to know, is there a kind of, if you're not having symptoms, but you know that you've been exposed to somebody who has tested positive, is that a priority for being tested yourself, even if you're asymptomatic?
So again, another excellent question. So at this time, the testing algorithm does not include folks who may have been exposed and who are asymptomatic at the time. So the advice I would give to that person is to self-monitor at home, meaning you can check your temperature once or twice a day, monitor yourself for cough or chest pain, try to keep some social distancing, which most of us are doing now. And if there's anyone at home who could be at a higher risk of getting sick, take extra precaution around that person and just monitor for your symptoms.
Thank you.
Yeah, David, it's good to see you, by the way.
Yeah, you too, Alex.
I'll tell you, we have our first doctor in Greenwich Village, primary care doctor, that's doing home visits via telemedicine. So that's just starting to come off the ground. He is literally the first one down here. He's already started that program, started seeing patients, Dr. Eric Asher. But exactly what you're describing is a perfect fit for something like that. So I believe that's going to be something that's rolled out more and more as we're going forward. But I think this event is going to push that even faster.
Great. Well, it's been very helpful. I just want to say thank you all for taking the time to talk with us.
All right, thanks. I've got a question from Shirley Smith. Shirley? Shirley, are you there? I don't have you, Shirley. All right, we'll come back to you if.
No, you can't hear me?
I can hear you now. Yep.
Okay, great, thanks. I was just saying, thanks so much, doctors, for coming, and I share what my colleagues have said. My question is, and my name is Shirley Smith, how much are you charging for the test? Because they said the test would be free of charge.
Alex, you want to take this one?
Yeah, I'm not sure how that's working exactly right now. It's a brand new test. I would say that if you're coming to the emergency department and you're sick, you would get an emergency department bill. I don't know that the test would be separate there. And as far as the drive-thrus are concerned, quite honestly, not sure how that's working. I can find out for you and get back to you.
All right, thank you.
You're very welcome.
Susanna?
Hi there, and thank you guys again for coming tonight and for pulling this together. We just started talking about this a couple of days ago, so thanks for being here. Most of my questions have been answered. I had one question, which is about your staffing. How are you guys staffing the emergency department in our neighborhood right now? How many physicians and how many licensed nurse practitioners and physician assistants and so on?
Hey, Shirley, how are you? Suzanne, I'm so sorry. So our staffing is unchanged. So our staffing tonight is the same as our staffing was 2 weeks ago, is the same that it was 6 months ago. So we've been, again, preparing for potential call-outs and persons who may not be feeling well. So we've activated actually a sick call program. So our current staffing model, at our busiest times of the day and evening, we have 5 providers, 3 doctors, and 2 mid-levels, either PAs or NPs, in addition to 8 nurses, and 4 patient care technicians, in addition to the rest of the administrative staff. So our staffing model, we sort of staff to the busiest times of our day, and we've been watching our numbers since the sort of pandemic began to see if our numbers have statistically significant change, which they haven't. So we've kept our staffing model exactly the same.
Thank you. And so are you, I think what I just understood you to say is that your crowd, the people who are, you haven't seen a great increase in volume and people coming to the emergency room.
So we don't have enough data points yet. Based on everyone that we're talking to, this is the first real week where volumes and sort of the rate of arrivals and census is changing in other departments. So we're going to start looking this at week's end, and then we're going to start comparing it to the week before and the same week a year ago. And we're a very tech-heavy department, so we're really into data analytics. So we're going to study this very, very closely.
Right.
So I will tell you, in most of the areas, as far as volume is concerned, we haven't seen a big change in volume. It's gone up and down in different places. However, the patients that are coming in are different, right? There's much more respiratory patients that are coming in. Patients with colds, flus, and everything else that think they might have COVID-19. So we do have a different mix of patients. As far as staffing as well, so one thing here is for staffing such as secretarial or folks that don't need to be clinically on the floor, a lot of them are now working remotely as well. And some folks we transition on and off. So we are trying to do things to preserve the staffing, to not put them in harm if they don't need to be. And also for people like me who's administrative, they've asked to rotate. So if one of us gets sick, somebody else can pop in their place and we can keep the place running.
Great, thank you guys.
Great, thanks. I've also got a question from Amy Brenna. Amy?
Hi, thank you. Thanks again for coming in. I have a quick question. Does your staff have the materials they need? We're hearing a lot about, not enough masks and things like that.
Yeah.
How is that going for you? Do you see what do you see in the future, near and long term? And I hope your staff are staying healthy. Are you seeing anyone getting sick on your staff because you don't have the right materials?
Yeah, I will tell you, this is something that we have a materials management team that works really, really hard every day to make sure that we have everything that we need. So we're doing really well. The toughest part of this from a PPE, a personal protective personal equipment perspective, are the N95 masks. It's really tough. There's truly not enough to go around. So we work off of sort of a par level. We try to keep it going. Every hospital is looking for more and more of these. So we do have it. We're trying to control it so that we don't run out. But I will tell you one thing that's been fascinating to me. Yesterday specifically, many community members came to the hospital to deliver pizza for the staff, coffee, cookies. And there was one individual woman that was outside, and she had a box in her hand. She was motioning that if we maybe had a mask for her. And so I grabbed one of the surgical masks and I went out, and she said, no, I don't want a mask. I want to give you this box of N95s. And after her, somebody else came in, and literally while I was on this call, I just got a post-it that somebody called and said that they have N95 masks. So now to me, I will tell you, when we're in crisis is when you really see the good of people come out. And we've really seen that here. I was really touched by it, but that is probably the hardest thing for us and for almost every hospital is the N95s. As far as the gloves and the gowns and the goggles, the face shields, we're doing pretty good on all of that. The N95s are really tough. So we are controlling it, but we do have what we need at the moment. But it's a day-by-day type of issue with those masks. But thank you for asking.
Yeah, I'm concerned for all of you. My dad was a doctor. So just if you could just tell me, do you need a new one every day? Can you reuse an N95 mask? I mean, I'm just curious. So
there's policies, there are CDC suggestions. The CDC suggestion is that you change the mask every 5 interactions. For us, that can be multiple times a day for multiple people. So what we've done is we have them wear the N95. we put a surgical mask over it to preserve it for a little bit longer. And we ask them to try to keep that mask for 2 or 3 days with additional masks that go over it so it doesn't degrade or get sprayed on. If the mask gets soiled, they're to throw that away immediately and get another one. And with that, we've been able to maintain, but we do try to prolong the use just a little bit so we can keep them in stock.
Okay, thank you. I've also got a really good question from Cormac, one of our board members, and he asks, what about people who do not have a primary care doctor since many insurance plans no longer require it? If someone is sick with suspected COVID-19 and self-caring at home, should they tell someone in terms of tracking?
So
I'll let you take that one.
Yeah, absolutely. So just to clarify the question in terms of should they tell someone as in like the Department of Health or who in particular?
Cormac, if you want to jump in, but I'll just from his question, it's basically saying if you don't have a primary care doctor, you're at home, you get sick, and you're taking care of yourself, and you think you've got COVID-19, should you be telling anybody as far as, I assume anybody, any medical professional that should be aware of that fact?
Yeah, I that's a great question. I think from a public health perspective, if you're not feeling well, you probably shouldn't, be in a room with close contact, not wearing a mask with anyone. In terms of if you're not feeling well, again, everyone's got to have their own internal threshold for what that means. So it may mean something different for everybody listening to the call. But certainly if you don't have access to a healthcare provider and you're feeling ill, you could certainly come to the ER to get evaluated. That's what a lot of people have been doing and will continue to do. If your symptoms are mild and you think you can self-monitor at home and you still want to go and see somebody, I think an urgent care is a nice in-between. They're not open 24 hours a day, but typically most of them are open 12 hours a day. And you can always, hop online and check out GoHealth and see what their hours are, and you can even make appointments ahead of time.
Okay, and we've got one last question, which I think is a really good question. Actually, 2 more questions. One, does a painter's mask or a construction mask work at all, or does it need to be a medical mask? I guess an N95 mask.
Yeah, I think we would. Yeah, an N95. We would probably have to have our materials management team take a look and see what the actual structure of the mask is, if it can, be utilized in the same environment that we're using the N95s. So I would probably turf that question to one of the materials management people.
And then a question which my sister texted me, but I don't think she's is actually, this was to my parents, and what are the safe, what precautions should older people take when they're going shopping at the grocery stores?
Yeah,
that's really, I think, one of the most real questions as far as our community. What should they be doing? If I'm sitting in the community board conference room right now, I'm across the street from Morton Williams, and when I came in, I saw a couple of older people going in, and what should people be doing?
Yeah, I think that's a challenging question. I think whatever you can have delivered, get delivered. I know a lot of the delivery services aren't bringing things up to apartments, so they're leaving them doormen. So if that's, an option you have in your building, I think that's a great option. But if, you don't have that option and you need to go out in the supermarket, I think for at-risk people, wearing a mask is not a bad idea. Again, trying not to be in close quarters with people. If you see someone who's coughing or sneezing, turn your back, create some distance. So the best way to mitigate transmission is going to be distance and protecting your face and nose from someone who could be potentially sick. So again, it's challenging. Space is limited here in New York. I live in the Village as well, and my wife and I have been to the supermarket a handful of times over the past week, and it's been really, really challenging. So I think, you just have to try to use, whatever resources you have available, and really keep the space issue. We're using 10 feet as a number that we're sort of telling folks in the hospital is a safe distance. So if that's feasible, then that's something you should try to implement.
My dad is 82, and I told him, Pop, I'll go to the supermarket for you. Tell me what you want. He said, absolutely not. But the fortunate thing there is I believe now they've opened it up about 6:30, 7:30 a.m. For folks that are over a certain age. I don't remember exactly what that age is, but it's for the elderly. They can go in. It's much less crowded. So they've actually implemented that in some of the stores around where he is. And it does make it easier for him to get in, get the food he needs, and get out without too many people in close quarters.
And it's interesting to bring that up because that's actually what my sister had texted was, what should they be doing during senior hours? Yeah. And I've got one last question from Valerie. Valerie, are you there?
Thank you. Thanks again for your time. My question is probably something that we'll all encounter in the next couple of weeks or so. So I'm going to ask it generally broad here is what happens if you do receive that email or that text from a friend who says, I've been around you during this time period and I have tested positive, but you yourself are not showing symptoms. What is the best practice there? If you're not feeling well.
Before they leave, just want to ask Alex something. In light of what Dr. Levy said about if you're feeling ill and you don't have a primary care doctor, you can always go to the emergency room. But if you're not that ill, you can also go to an urgent care facility. Mm-hmm. It's probably less expensive for someone to go to an urgent care facility, right? They shouldn't go to the emergency room unless they're really sick, right?
Yeah, no, the urgent cares are certainly less expensive. They don't have the same kind of overhead by any means of what an emergency department does. I use them myself, so it really depends on how you're feeling. Okay. If you need a chest X-ray, that kind of thing, if your acuity level is going up, certainly you need to come into an emergency department to get the CAT scan, et cetera. But other than that, you really can't stop in. The Go Health are really good partners of ours down here. And if they think that somebody needs to be escalated to a high level of care, they get one of our ambulances to bring them here or they let them know that. But yeah, I would say if you're not feeling too sick, the Go Health is a fine place to, an urgent care is a fine place to go first.
Yeah, thanks. I was just thinking about the cost of this.
The cost is much less in an urgent care, no question about it.
I'm sorry, this is Amy Brenna. Should you notify the urgent care before you show up, or do you just show up?
You can. You don't have to. I think Go Health actually has an ability to put your name in for an appointment online before you get there and fill out most of your paperwork. So you just go right in. They've made it very, very easy for you.
Okay.
And they've also developed, just a quick aside about at least the Go Health, they've put in a mechanism where if you're making an appointment to go and see them, they'll communicate with you before your appointment and ask you if you're having any flu-like symptoms. And if the answer to that question is yes, they'll arrange for someone to meet you outside of the urgent care and hand you a mask before you come in so that they can at least create an environment that's safe for other patients who may be in the waiting room.
Good point.
Thank you, Wayne. Thank you, Alex. Thank you, Dr. Levy. It's been really helpful.
Can I just add one thing?
We've spent a lot of time on this and we've got to move forward. So we'd only allocated 15 minutes. So I'm gonna move on to the next portion of our meeting. So thank you guys. I had one elected official, I think, which, and you guys are from, just so everybody who knows who may have joined us, you guys are from Lenox Hill, Greenwich Village, and that, as most people know, is our emergency room for our community. So thank you guys.
Thank you very much, guys. Stay
safe, everyone. Thank you.
Thanks. Iraq, are you?
Carter, can I just add one thing here? Number one is that there are multiple telehealth services available at New York Presbyterian, NYU, Northwell Health, and Mount Sinai. So if anyone needs to get a doctor's order for a test, they can go to telehealth at any of those hospitals and get a doctor's order if appropriate.
Okay, thanks, Ritu. Iraq, are you with me?
Back here.
Right.
Hear me?
Yep, thank you.
Yes. Oh, thank you. So very quick, I'll be very, very brief. So our office, from the Office of Council Member Carolina Rivera, we moved fully to work remotely now, but we're fully accessible. Everyone who can call our office will be calling you within the same day. The councilwoman has been in constant briefings with H&H and Greater Hospital New York Association, and we created a webpage within our council webpage that is a COVID-19 exclusive updates. We're updating it mostly daily. I'm gonna put the link on the chat here. Also, one thing that we're focusing is on calling all the soup kitchens and pantries in the district to gather information of up-to-date information on how they're operating. And a lot of them are expressing concerns because volunteers have decreased. So they're asking for us to gather this information. I also gonna put here the email and phone number for you to call us if you want to volunteer with any of these organizations. We have plenty of them, and the help is very needed. Other than that, I encourage you to look at the webpage to have a very up-to-date information on this, and stay safe and enjoy social distancing. I mean, it's a new way to do stuff, and congratulations, Karen, CB2 for setting a mark here on how to do things and adapt to a situation.
All right, thanks, Sarak from Councilmember Rivera's office. Do I have any other elected officials, reps that I missed? I know I've got a few who normally give our updates, but we actually had their respective elected officials actually spoke themselves. I see Andrew on there as well. Okay, so everybody's had their reports. Okay, so that's going to conclude our elected official reports, unless we have anybody else who might join us. We'll move on to the chair's report. I think, some of the information that we've gotten, that we've seen tonight is, it's pretty, I see somebody who's, oh, there we go. You're sharing your screen. Do you want to put that link in, Iraq, into the comments instead of sharing the screen? Or I'm not sure who's sharing this, actually. All right. So moving on to the chair's report, I'm Carter Booth. I'm the chair of Community Board 2. This is our March 2020 full board meeting. Last month, we streamed our first meeting, never thinking that we would be meeting virtually. I think that's a pretty sudden shock. The comments that we heard earlier from everybody, we're obviously living in a different world, and the goal of tonight's meeting and our business session is to really put pre-COVID 2019 behind us and move forward. One of the things that we heard a little bit tonight is, what can we do? And one of the things that we can do is really reach out and help the most vulnerable in our community, our neighbors, the people who are next to us, people who get sick. There's a link on our website, on our calendar and we've sent it out multiple times, the New York City Department of Mental Health website that's got plenty of instructions as far as what to do if you're helping somebody, how do you clean your building hallways. There's a lot of information on there. I keep having Bob put it on there and sending it out because it is so informative, and it's constantly updated along with the New York State Department of Health website and the CDC. As we kind of move forward tonight, I'm trying to keep the committee reports succinct. I think that most of the chairs are aware of that. I mentioned in our executive committee. Wanted to thank Bob, Josh, Florence, and Eva in our office who've been doing a great job. Our office is closed, is to the public, and if anybody's got any comments or questions, they can email the office. We're going to be taking a break, I think, for the next few weeks as far as any committee meetings as we go forward. We are going to have a weekly executive committee meeting virtually on Zoom to just sort of discuss where we are each week as far as going forward. Many of the city agencies, Bob's going to give us an update, many of the city agencies continue their business, not as usual, but they are continuing their business, and a lot of that business requires our input. And that we're going to figure this out as we go forward and as we see what happens. I mean, that's really one of the very sobering realities, is we're not really sure what's going to happen. And that's something that we're going to have to wait and see. I think we're gonna go forward from there. Bob's gonna give his chair's report, and I'm gonna jump in at the end with one of the updates on one of the agencies. Bob?
Okay, thank you, Carter. As Carter said, I just want to say that like many or most of our colleagues in government and elsewhere, my staff has been working from home all week. I want to thank them for the work they've been doing. Starting tomorrow, I'll be working from home as well. And although our office will be closed, we'll be trying our best to perform all our administrative duties and to serve our constituents. I would like to say that if anyone needs to get in touch with us, the best way to do that is by email. And we'll do the best we can to respond. Regarding some agency updates, information we've either received from agencies or that they've posted regarding public hearings, meetings, and other events. The Landmarks Preservation Commission has canceled all public hearings for the remainder of March. Although future hearings will still be scheduled. In fact, they have scheduled one for April 7th. They have advised everyone that that's subject to change. I'd be surprised if it didn't change. And they've asked everyone to please check the website for regular updates. City Planning, Mayor de Blasio has temporarily suspended all of New York City's land use decision-making processes. All City Planning Commission meetings, including public hearings and votes required as part of the ULURP process, are suspended, and the time periods for hearings and votes will not run. We've been receiving notices by email over the past week or so from the Mayor's Street Activity Permit Office that events that they have permitted have been, many of those events scheduled for the next couple of weeks have been denied. So I spoke with the director this morning, and he told me that his agency, SAPO, as well as the NYPD and the Parks Department, are revoking any permits that have been issued or denying any applications that have come before them for any events of 50 people or more through April 12th. And they'll continue doing that as warranted going forward. He did say that any multi-block event that has been canceled for this year will not be allowed to reapply. They'll have to reapply for next year. If it's a smaller event, a single block event, they can reapply to have their event later in the year. And lastly, the Department of Consumer Affairs, I'm kind of waiting for a final clarification, but apparently they are not currently scheduling any new public hearings at this time. And Carter, I think you wanted to talk about the SLA.
Yeah, and just for the SLA, they've suspended 500-foot hearings for the time being. Full board meetings are still being conducted. They're actually utilizing the same executive order from the governor to conduct their meetings to some extent virtually, and the public will not be included in their full board meetings. However, written submissions from the applicants or those in opposition can be submitted prior to the meetings, and they will adjourn any items. We have 2 items in our community board before them next week, and I believe that people are requesting that those be adjourned until April 15th. And the reason we're doing this is to just so people understand that some businesses is moving forward in the different agencies in different ways, and we play a role in that process, and to not have committee meetings should we need to in the coming weeks and months would be to sort of abdicate our responsibility for providing guidance to those agencies. That being said, I think that I've hit most of the points. I've got notes all over the place, so I probably missed a few things. And thank you, Bob. And Bob's really been doing a great job. He's actually in the office, and I'm in the conference room, and this is probably going to be the end of both of us being here at the moment. So we're going to move on now to our business session and get a motion to approve our February minutes, which were distributed by email to the board members by Bob. Is there anybody like to make a motion? Somebody will have to unmute themselves.
So moved. So moved.
A whole lot of people have
second.
That, so okay. All right.
Didn't you move and second, Susan?
Someone beat me to it.
All right, so we're going to move
I'm streamlining.
We're going to move in now into standing committee reports, and our first committee report is Schools and Education Committee, and Janine Kiley. Janine, are you still with us?
Let me unmute.
All right.
Did that. I lost the page. Just a moment. Sorry.
And so while Janine's
sorry.
Go ahead.
We passed 2 resolutions unanimously. Resolution number 1 is in support of state legislation to mandate early screening, intervention, dedicated schools and teacher training programs for all children with dyslexia and other phonological learning disabilities. Therefore, be it resolved, CB2 supports the passage of New York State Senate Bills S4341, S7093, S5608, S5697, and S4342, and New York State Assembly Bills A5259, A8786, A7210, A6911, A5038-A, and A6450, and urges the governor to sign them into law, and urges our elected officials, the New York State Education Department, and the New York City Department of Education to support mandatory early screening, interventions, dedicated schools, teacher training, and testing accommodations for all children with dyslexia and related learning disabilities. The second resolution is in support of state legislation to mandate screening and intervention for all incarcerated individuals with dyslexia and other phonological learning disabilities. Therefore, be it resolved that CB2 supports the passage of New York State Senate Bill S6787 and New York State Assembly Bill 8722 and urges the governor to sign them into law, and urges our elected officials, the New York State Education Department, the New York City DOE, the New York State Department of Corrections and Community Supervision, and the New York City Department of Corrections to support mandatory early screening interventions, dedicated school for all, that's a typo here, so something got mixed up in there, for all individuals who are incarcerated in New York State, or incarcerated individuals. And I will fix that and send that to you, Valerie.
Okay, so, I had actually neglected to mention at the beginning of this, the way we're going to conduct our business session is that we're going to keep adding the committee resolutions into one large omnibus vote. However, if somebody wants to call out an item, we can call it out and discuss it and vote on that separately. But because we're doing a voice roll call votes, I thought that would be more expedient. Does anybody have any comments on either of these resolutions, or you can either raise your hand or okay, so I'm seeing no discussion. I wanted to thank you, Janine, for the great work that your committee did and has been doing on all this work. It's really been great, so thank you. So we're going to put those 2 resolutions from the Schools and Education Committee into the omnibus vote, and we're going to move on to the Arts and Institutions Committee. Robin Rothstein, I believe you have 2 resolutions.
Yes, can you hear me? Am I unmuted?
Yes.
Right, there are 2 resolutions, but they're associated, so it's almost like part 1 and part 2. I'll read the titles and the therefores. Proposed language for CB2 resolution regarding qualifying tenant for restrictive declaration for the community benefit space at 46-74 Gansevoort. Text will be modified to match finalized restrictive declaration currently before City Council. And I should mention that I'm already planning on giving myself friendly amendments to these resolutions, and I will ask Carter how you want me to handle that. Therefore, be it resolved that CB2 Manhattan strongly supports the proposed language outlining the baseline requirements for a qualifying nonprofit performing arts tenant for the benefit space at 60-74 Gansevoort, and therefore be it further resolved, CB2 Manhattan also strongly supports the strategy that more specific criteria will then be identified by CB2's Arts Committee or equivalent to be applied by the appointed Arts Advisory Panel during the application process for these spaces. The second resolution, which is very similar but is about a different space and has slightly different criteria. Proposed language for CB2 resolution regarding the qualifying tenant for offsite community benefit space at 7-11 Weehawken Street, 300 West 10th Street, and 171-177 Christopher Street, agreed to in conjunction with 46-74 Gansevoort Street, restrictive declaration. Text will be modified to match finalized binding letter currently before the City Council. Therefore, be it resolved that CB2 Manhattan strongly supports the proposed language outlining the baseline requirements for a qualifying nonprofit cultural and/or arts organization tenant at the site comprised of 7-11 Weehawken Street, 300 West 10th Street, and 171-177 Christopher Street. And therefore, be it further resolved, CB2 Manhattan also strongly supports the strategy that more specific criteria will then be identified by CB2's Arts Committee or equivalent to be applied by the appointed Arts Advisory Panel during the application process for these spaces. Vote unanimous in favor on both. And like I said, I have amendments to myself.
Okay, in the interest of expediency, why don't you go ahead and
they are both they are each in the same corresponding place for both resolutions. So it's the second to last whereas in the near the end of it, where it says panel is recommended to be comprised of the chair of CB2 or designee, the chair of the arts and institutions or equivalent. Then it's going to say committee, a member, sorry, I screwed this up. A comma, a member of arts and institutions or equivalent committee, comma, a member of the land use committee or equivalent committee, and at least one other individual. And so essentially we're adding a second arts committee member and reducing the two individuals to one. Does that make sense?
It does.
Okay, so that's the same for the second resolution, the same edit. And then the same edit in the second, therefore be it resolved, would read now instead, CB2 Manhattan also strongly supports the strategy that more specific criteria will then be identified by CB2's appointed Arts Advisory Panel during the application process for these spaces. So we're striking, after CB2's, striking the word arts through the.
Okay, great. And can you email that to Valerie and to
Yep.
Lawrence? Okay.
Yes.
Does anybody want to discuss either of these? I see that there's two hand raised. Dr. Smith, are you looking to speak on this? Should I unmute you? I will unmute you. I can't unmute you. Dr. Smith, are you, okay, I know I see your hand raised, but I don't see you. Frederica, I see your hand raised.
Yes, I'm just wondering how many people will be on the advisory committee with that change?
It's the same amount of people. Instead of two sort of random members to be selected, it's now going to be one. We decided it was better to weight the arts committee to have two people instead of just the arts chair. Another member of the arts committee would be on. So it's the same same number of people.
All right, thank you.
I see, okay, thanks, Frederica. I see somebody, I just see them identified as iPhone. And
Carter, it's Katie.
Katie, okay.
Robin, would you just repeat the second correction? I just didn't hear all the details.
Yeah, all I'm doing is striking something. So I'm striking in the second sentence, in the second, therefore be it resolved, I'm striking the word arts through the word the. So it reads, CB2 Manhattan also strongly supports the strategy that more specific criteria will then be identified by CB2's appointed Arts Advisory Panel during the application process for these spaces.
Thank you very much. That's much clearer. Thank you.
Thanks, Katie. Any other questions? Shirley, Shirley Smith, I see your hands raised, but I can't unmute you, and
perhaps you can comment?
Yeah. Okay, I will lower your hand for you, and if you have something to add, you can jump in. Okay, so is there any other comments or questions on the two resolutions for the Arts and Institutions Committee as they were presented? Okay, so we're going to move those two resolutions from the Arts and Institutions Committee into the omnibus vote, and now moving on to the Traffic and Transportation Committee, Shirley Secunda. Shirley,
Okay, I just got unmuted.
Yep.
Can you hear me? Okay. So the first resolution is in response to the Port Authority's presentation on their project to repair Hurricane Sandy damage in the Holland Tunnel, which is supposed to begin end of April. And since the project will be done at night, we're asking that noise be minimized as much as possible in whatever way possible, and also for a community liaison for people to contact. We are also asking Port Authority to consider storing the portable flexible gates they're using for protection at the portals, which right now are to be stored far away from the tunnel, and we're asking for them to be stored closer to the tunnel, somewhere in CB2, such as at Pier 40. So that is Reso 1. And our second Reso, of two Resos, requests that the Transportation Mobility Review Board that's working out the congestion pricing plan to make sure they include at least 2 Manhattan residents as members, one residing within the congestion pricing zone and one residing beyond the zone. And that's it.
Okay, great. Do we have any comments on the 2 resolutions that Shirley put out? That's from the Traffic and Transportation Committee. If anybody does, if you can speak or raise your hand. Okay, seeing no discussion, we will move those 2 resolutions into the omnibus vote that we're going to do. So that's 2 resolutions from the Traffic and Transportation Committee. Now moving on to landmarks. Chenault Spence. Chenault, are you with us?
I'm here. There are several, all are unanimous, and I'll summarize each one. 657 Greenwich Street is the fence on Christopher Street that shields the playground of the St. Luke's School. It was an effective presentation in that they left out the most important part, which is that the fence and its covering were, they're asking that those be made permanent in addition to a modification. And the fence we described as a construction fence and not at all suitable to permanence. So we rejected the, we recommended denial. And then some specifics about removing the materials that are thought to be objectionable and coming up with some solution to make the whole area be sympathetic to the district, and that they come back to us. Green Street, demolish a loading dock, which in this case we recommended approval for, and construct a new sidewalk and reconfigure the entrance stairs. In particular, we're happy that vault lights are included. (15 7th Avenue) is the one of the hospital buildings that's been repurposed into Greenwich Bay. We recommended that 2 signs which fit within the architecture and design of the building be approved, and that there not be a flagpole on the corner sticking out at an odd angle. 446 Broadway, replace storefront infill, which is not objectionable, and again, vault lights, which were the theme this month, we were happy about. And there's some minor changes we suggested in the design, and it's approved. A layover of McDougal Street, West 10th Street, a thorny problem of through-wall air conditioners, and in this case, it's not a beautiful building, it's a typical tenement building, and it just spoils the facade, which is not unattractive and completely intact, among other things. And we recommend denial of through-the-wall air conditioners. 97 Greenwich Avenue is the sports club that's been through some recent changes on the ground floor to make it I would say charitably less offensive. And the proposal was to paint it dark gray and black, which we felt was just totally wrong. It makes it a great hulking thing amidst some altogether quite nice buildings. On the one side are row houses, the other side are avenue type buildings. One rather fancy building that's of the tenement style. We recommended out and out that it not be approved, and another withdrawal. That's it.
Okay, so you've got the 7 resolutions.
It's 6, one withdrawal and one late.
So which one was?
Unless I misnumbered them.
Okay, so there's 6 resolutions. Let me just correct my notes here. So you have 6 resolutions. Would anybody like to call out any of those items or have any comments or questions on any of the resolutions which Chanel put forward? I actually wanted to step back for a second, and I wanted to get a motion to have these put on the floor. Is there a motion to put these on the floor? Because there was not a quorum at the meeting.
I'll move
that. I move.
And there's a second?
Second.
Okay, so we're going to be considering those 6 resolutions that Chenault had put forward. Chenault's meeting was actually the last in-person committee meeting that we had. And the night before that was the landmarks committee, the land use committee meeting, which we had canceled. So I don't, Susanna, I see you have your hand raised.
Yeah, hi, sorry, I have a question about the air conditioners. So that's a change, obviously, that's made to make life in that building much more comfortable. Window units are, people don't like them because they block the one window in their apartment or whatever. Is it common for us to make these aesthetic choices to overrule, convenience and comfort?
We didn't consider the comfort. I'm not sure why it's so, just the pure temperature comfort, why it's more comfortable to have a through the wall than a window. I would dispute that.
No, it's not more comfortable. It's more aesthetically pleasing if you're in the apartment.
Yeah.
In the apartment, you lose a window if you have a window unit, and if you have a through the wall unit, you get that comfort without losing
it really, I said at the meeting, this is is a vexing thing. It came up at 2 Fifth Avenue, which, whatever one thinks about white brick buildings, is a rather carefully designed one. And it was with some reluctance that we approved it there because it fit into the architecture better. And it's not a historic building.
Yeah, good.
In this case, it's just destroying a lot of historic material and aesthetically unpleasing.
The landmarks criteria is not what it looks like from inside the apartment, but what it looks like from the exterior. And as Chanel regularly reminds me when I bring these issues up, is that the criteria is very narrow, and it's with respect to what's visible from the exterior, and there's a very narrow vision that as far as applying the landmarks rules to the buildings and the recommendations from the committee. It's the very narrow world that they exist in.
I actually saw one on Hudson Street right around the corner, I guess just north of Greenwich Street. And it's painted or not painted, it really does great harm to a facade to make these piercings.
Okay, thanks, Chanel. Do we have other questions? I see Shirley Secunda. Shirley.
Yeah, I was under the impression that not allowing the air conditioners to be within the walls was an actual rule, guideline of the Landmarks Preservation Commission. Is that not the case, Chenault, or is it?
I didn't question them. I believe it. I don't recall that we've had this come up except in 2 Fifth Avenue. I'm inclined to think it is because it involves such a large destruction of historic material.
Okay, thanks, Sean. Do I, any other questions? Okay, so seeing none, I'm going to move those 6 resolutions that Chenault had just presented from the Landmarks Committee into the omnibus vote that we will be having. And the next committee is SLA licensing number 1, Donna Raftery.
Okay, you hear me? Yeah.
Yes, hi Donna.
Hi. So we had 8 applications this month. We heard 3 of them. The rest were laid over or withdrawn. All the votes were unanimous, deny unless. So the first was an alteration to a full OP. Sophia's Little Italy at 143 Mulberry Street is to move the bar from the rear of the restaurant to the front of the restaurant, reduce the seating from 7 to 4. That was deny unless. Next was another alteration to a full OP for Aunt Jake's at 133 Mulberry to add a sidewalk cafe to the license. That was deny unless. And then the last was an OP for a new restaurant at 195 Spring Street called Mancinello. This had been licensed before, and basically the hours, it was for also sidewalk cafe, the hours of the restaurant, and the sidewalk cafe are basically the same as what was there before, so that was deny unless. The remaining 5 were laid over or withdrawn, and that's it. It was a quiet month.
Okay. Would anybody like to call out any of the items? There are 8 resolutions in total. Numbers 4 through 8 were no-shows or layovers or withdrawals. Anybody can speak up or raise their hand. Katie, I see you have your hand up.
Was there a quorum at this meeting? I see that it was 4-0. Seems like it was.
Oh, that's a good point. Yes.
Good point.
Looking at SLA number 2, let me just look back here and just take a look.
I thought we had a quorum, but
I can't tell. I wanted to check on that. Just make sure we do it correctly if you didn't.
I think you're correct. So we'll have a motion is there a motion to introduce these resolutions?
I so move.
Is there a second?
Second.
Okay, so we're going to have items 1 through 3 and 4 through 8 are on the floor for consideration. Is there any discussion as they're introduced by Donna? Is there any discussion, or would anybody like to call out any of those items to discuss? Okay, seeing none, we're going to move on and add those 8 resolutions into the omnibus vote, which we will be conducting at the conclusion of the committee reports. SLA number 2. Bobby Elliott, are you with us?
Here. So I would like to start out by saying that I think it's wrong that Brian Pape is in some tropical island somewhere while we're all here in Greenwich Village. What the heck's going on there, Brian? I think that's wrong. It was similar at SLA 2 that took place at SLA 1. We had 15 applications. Out of those 15 applications, we had 5 which we heard. 1 of those 5 was withdrawn at the meeting. The second one was put over to the next month. So we really made recommendations on 3 applications. The first one is KG715 Upholstery Store, 713 Washington Street. This is an existing on-premise license. It really was just a change of ownership. The main owner was taking over from taking 100% of the ownership of the restaurant. Everything stays the same. The same stipulations are in place that existed. Number 2 is that was deny unless resolution and a unanimous vote. Raoul's Restaurant, a pretty well-known restaurant on Prince Street. They're looking to add a second storefront right next door. This application was heard, I think, about a year ago in the SLA 1 committee. That was approved, just like this one is, deny unless with stipulations. So that would be an alteration of existing license. Number 3 is the Other Room Holdings, 143 Perry. This is a tavern that's been around for a while. a small tavern. Again, a change of ownership. A new owner was coming in and kind of taking over for the other owners. It also it's basically the same exact operation as before. There's really no changes whatsoever. It's just new ownership. The same manager is staying on, and so not a whole lot. That was a unanimous vote denying less resolution. The rest, 4 through 15, are all withdrawals, layovers, and no-shows.
Okay, so I've got items 1 through 15. Would anybody like to call out any of those items? If you could just speak up or raise your hand.
Carter?
Yes.
I need to recuse myself from number 3, the other room.
Okay, so I was going to bring that up. So we're gonna just make a note of that. We're going to still do this as an omnibus vote, but Valerie, can you make a note that Rocio is going to be recusing herself on number 3?
On SLA 2, yep.
On SLA 2, because she's the owner of the building.
Got it.
Thank you.
Does anybody else like to say anything? Any other comments, questions? Okay, so we're going to move items 1 through 15 from SLA 2 into the omnibus vote, and no discussion. All right, so we're going to move those in, and next report is quality of life from Joe Gallagher. Joe, are you with us?
Yes, hi, good evening. So the first, we have 3 unenclosed sidewalk cafes, new applications for revocable consent to operate an unenclosed sidewalk cafe. And the first is White Horse Hospitality at 567 Hudson Street between West 11th and Perry Streets. And it's with 28 tables and 74 chairs. There's just a typo in the hours. It should read the third whereas down. The hours should be, the cafe will close by 11 p.m. Sunday through Thursday, and midnight on Fridays and Saturdays. Can you make that change just directly?
Yeah.
Oh, thank you so much. Okay, sorry, and these have to be put forward as recommendations because we were 1 short of a quorum as well.
Okay, so after you finish reading them, we'll do that.
Okay, so this one was recommended unanimously approval. The second is Super Noriega Baby Brasa, 173 7th Avenue South between Perry Street and Greenwich, with 6 tables and 12 chairs, and the committee recommends approval, recommended unanimously. And the third is the Village Den at 225 West 12th Street at Greenwich Avenue, with 6 tables and 12 chairs. And this one is recommended approval unanimously. And Bob Ely sent a friendly amendment for number 2 for Super Noriega. Can I just give that to you now to speed it up?
Sure, and if you could send it in too, just...
Yeah, sure.
Yeah.
So it would be another whereas, this is from Bob, that would say, whereas the applicant currently is aware that he does not have a license to serve alcohol in the sidewalk cafe, and stated he would be applying to alter its liquor license for that purpose in the immediate future. And I'll send that to Valerie. And that was, the applicant stated that in the meeting as well. So it's, he understands that to be the case.
Okay. If you could just email that one since it's a little longer, that would be great.
I will, for sure.
And just that it should probably note the exterior sidewalk cafe, correct? Because they have an enclosed sidewalk cafe as well.
Yeah, they can serve in the enclosed, but not in the, right? I think they have the...
Yes, that's right. I just for clarity, because...
Okay, I'll add outdoor sidewalk cafe.
Yeah. And, okay.
Okay, and then next for the street activity applications, and as Bob was saying earlier on the phone, the news from SABO is that many of these have been canceled already, but I'll read them for the record.
Hold on, before you start, we didn't, number 3, the village.
Oh, yeah, I read it.
Oh, you did, okay.
Yeah.
Go ahead.
So number 4 is March 19th through the 22nd, the Dolby Store commercial event. The applicant didn't appear and the committee recommends denial unanimously. The next is March 21st, 2020. It's a J. Crew commercial event in Gansevoort Plaza. The applicant didn't appear and we recommended denial unanimously. The next is March 21st to the 22nd, the Guest J. Balvin commercial event, Broadway between West Houston Street and Prince Street, and East 14th, East 10th between 4th and Broadway, East 12th between 4th Ave and Broadway, East 13th between 4th Ave and Broadway, and Stage Fest at Pride Fest, 4th Ave between East 9th Street and East 10th Street, and 4th Ave between East 8th Street and East 9th Street, and then Kid Fest at Pride Fest in Astor Plaza South. And the committee recommended approval for all of those unanimously. The next is Gallup NYC on August 9th, 2020. The committee recommends approval. It's Hudson Street between West 11th and Perry. Recommended approval unanimously. The next is dinner on 8th, Thursday, September 24th, 2020, West 8th between McDougal and 5th Avenue. The committee recommends approval unanimously. And for the renewals, numbers 17 through 25, the committee recommends approval for all of those unanimously.
Kind of sobering, and a lot of those won't be happening.
I know it's, and also the Village Alliance, those two, they chose vendors for their artisanal market and their farmers market that were scheduled to begin in the next few months.
Okay, so that was, we had 25 resolutions, is that correct?
Yes, that's right.
Okay. So is there a motion to introduce these onto the floor? Consideration?
So moved.
Can I have a second?
Second.
All right, thank you. David, you have raised your hand. You have a comment?
Yeah. Joe, what was the one on Weehawken? You went a little fast. I didn't.
Oh, sure. It's the Hermance Farm, the people that run that farm and market on Christopher Street.
Okay, great. I didn't hear it. Thank you.
All right, sure.
And I see, Chenault, you have your hand raised?
Yes. With respect to number 2.
Yes.
Avenue South. There continue to be numerous landmark violations there. Is it, with all these complications of concerning the liquor authority's regulations, to have some sort of condition? It says there zoning and so forth, applicable zoning and sidewalk laws. Is it in order to that they have to be conforming with respect to landmarks?
So what I'm hearing is you want to add in there that...
What I would want is the landmarks violations corrected.
According to the applicant, he said,
condition.
As good as the applicant's word is, he said all of the landmark violations had been cleared and that they received a 6-year permit for the mural that's on the side of the building. That's according to the applicant, but I didn't verify whether that's true or not.
It's shocking to hear that. I would request that it be verified. If landmarks approved it, then there's nothing to say.
Okay.
But
Chenault, is there such thing as a 6-year permit for?
I've never heard of such a thing.
I'm sorry.
And if so, this was all done. I don't recall getting the resolution from the commission concerning this, which is not to say I didn't, but I don't recall it.
Okay. The resolution does say that very clearly the applicant stated that they're working diligently to get up to code with all relevant city rules and regulations and cleared up all violations from the last 2 years, including getting a landmark permit for the existing mural, which is adjacent to the unenclosed sidewalk cafe. So it does reference that.
There were things other than the mural. I don't have the thing before me, but
some lights or some other things like that.
Some lights, and there may have been an objection on the side street there. I'm not sure.
You have a suggestion, or
I'm asking
Joe to consider as a friend?
I think they shouldn't have it without this being with like certification that the landmarks have been corrected. Working diligently is something one can do for years. And they're quite frankly a bad actor and have been from the beginning with respect to landmarks.
I mean, unless you have something to add specifically, I'm not sure how we can amend that. Joe, do you have any thoughts on that, or do you think that it's sufficiently covered?
I mean, I'm happy to.
I would amend it that they're corrected rather than working diligently.
Oh,
Carter?
I mean, that would kind of be like a denial last, right?
Yeah, Bob?
Yeah. My recollection is that any sidewalk cafe application or applicant whose restaurant is in a landmark district, they need a letter from the Landmarks Preservation Commission kind of signing off on it. It's usually kind of pro forma, but we could probably ask landmarks to, I mean, I don't know how Joe would want to characterize it in his reso, or if we want to do it outside the resolution, but we could bring it to landmarks' attention and ask them to address any violations or anything that's outstanding, or at least a clarification on the so-called 6-year permit that they stated.
What about a friendly amendment just saying, whereas the applicant whereas the Department of Consumer Affairs should certify that all outstanding landmarks preservation violations are cured before considering this applicant for a sidewalk cafe?
Yeah, yes. So that it happens in order.
Yeah, and make sure that
violations are corrected, and I think corrected rather than cured is the term. That would be satisfactory to me.
Okay. And I can send that to Valerie with the other language.
Okay, so
this is Michael Levine. I have a question for the board. 3 of the members of the board sit on the Village Alliance Board of Directors, and Dinner on 8th is a Village Alliance event. Do we have to recuse?
We can. You're a little disconcerting in your green.
I apologize for the green.
I just looked up writing down my notes here. No, I understand. Yes, everybody can feel free to recuse themselves. So that would be yourself and
Cormac and Shirley.
And Shirley Shirley, is that something you'd like to be noted as?
I'd like to address that. I'm the community board rep to the Village Alliance, so I don't think that would apply.
You're correct. That's correct. But Cormac, do you feel that applies to you?
I mean, the thing is, I haven't before in years past, but yeah, it seems appropriate, so I will.
Yeah, you guys don't receive any financial benefit from that, but we'll note.
No, not at all.
So Valerie, do you want to note that on item? What item numbers are those? Michael, did you see that?
Hold on, I had it pulled up.
Dinner on 8th, which is number 16.
Yep.
And what was the other item?
I think that was it.
Okay. Is that right, Michael? Just dinner on 8th?
I may have stepped away because I don't see him on the green, just like a little bit. Oh, there he is.
Michael. Yeah.
I apologize. I had a phone call.
No worries.
So we're just starting now. Item number 16, dinner on 8th. And did we have another item?
Wanted to go back to 2. This is Katie Carter.
Yep, Katie.
I mean, wasn't item number 2 the one where we had received an email from a community member who objected to the noise from that sidewalk cafe?
Yes, that person had also appeared at the committee hearing, so his testimony was considered by the committee in making their recommendations.
Thank you.
So just going back, Michael, I had item number 16, and what was the other item number? That's dinner on 8th. Was it just dinner on 8th?
Just dinner on 8th. I felt I needed to recuse.
Okay. And that's in the quality of life. Okay, so Valerie, you got that?
Yeah.
Okay. Is there any other discussion? I've got a lot of hands up, I see. All right. Chanel, are you finished with, you brought yours up, right? You had your issue? All right, I'm gonna lower your hand. Kate, you did as well.
Quick question. I did notice on 23 Joe's Pub Block Party that had Village Alliance in parentheses.
I think that that's different in that that's not Village Alliance's own event.
Okay, perfect. Thanks.
8th is the Village Alliance own event. Okay. And I've got Bob. You made your comment, right?
No. I just had something to add to Joe, just as a suggestion on number 2. And that would be, in terms of the landmarks, maybe put it, instead of putting it in a whereas clause, put it in a therefore be it further resolved.
Yeah, that's good.
Yeah, that's it.
Okay, great. If that's okay with Chanel.
I think that sounds stronger. I don't think
it is.
Objection, right? Okay, Donna, did you want to jump in?
Based on the Village Alliance conversation we just had, I'm the residential representative on the meatpacking bid. So I don't know if I have to recuse myself. I would prefer not to recuse myself, but if that's the proper thing to do, I will, I'm fine doing that.
Okay, which items are those?
Oh, I'm sorry, that's item 13.
Number 13?
Well, Carter, if she would prefer not to, then I don't think that it's a requirement that she recuses herself.
No, the floral market is not a fundraiser. The Village Alliance dinner is a fundraiser, so the organization is getting money from that. And if you're an officer in the organization, you should recuse yourself. But if it's just being hosted by your organization, that's not a conflict.
Right. Okay, good.
Donna, you're going to withdraw your request? Okay.
Yes, I'm withdrawing my request. Thank you.
Right. Okay. Okay, so so that's, do I have anybody, Shirley, did you?
Yeah, I just want to clarify. I'm sure that if you're a representative from Community Board 2 to the bid, you don't have to recuse yourself.
Neither of those individuals are representatives from the Community Board. Donna is a residential representative, and Levine is a residential representative. Michael, so I think he's not a representative of the board. You are.
I'm not a representative of the board. I'm a public member.
Right, public member. There you go. So are there any other?
Okay, thanks.
Is there any other discussions on items number 1 through 25? Michael and Cormac are going to be recusing themselves on number 16, and number 2 is modified. If not, we're going to move those into the omnibus vote. And I also, I guess that Susan Wittenberg, you were trying to make a comment on something that had been moved into the omnibus bill. Did you?
Can you hear me now?
I can hear you. Is this Katie or is this Susan?
That's Susan.
Okay, Susan.
Oh, good. Hi.
You're coming up with Katie. That's why. Sorry.
Oh, how funny. Okay. Anyway, it's Susan, not Katie. I don't know why that's happening. I was communicating with Robin by email because we couldn't. Somebody, I guess you thought it was Katie, but I was trying to understand how the evaluation was made that the performing arts theater community was more in need of space than other arts groups. And I was just asking from my own experience in knowing what used to be available to the filmmaking community, which had to do with low cost editing facilities, low cost production space, shooting space, and I was questioning why that the priority that was not in the priority list.
The priority, I mean, I can answer that. The priority was included in the landmarks committee recommendation in the resolution, and is a part of the restrictive declaration that was separate. So what
you mean land use, right? Not landmarks.
Excuse me, land use.
Okay.
Sorry. Yes, thank you, Robin. So the land use had already been determined. What was before the committee on this one was the criteria to select the art group, which was not a part of that, because the choice had been left to the community board as far as the through the restrictive declaration and the side letter was given, the choice was given to the community board. Does that answer your question, or is that
No, I guess maybe then I don't want to belabor this because we're taking a lot of time, but I guess then what I wasn't clear about is that earlier on there was a decision that was made that the primary need in CB2 for a space for the arts was for theater performance, dance space, as opposed to other arts groups in what I felt was equal need. So I guess what you're saying is I missed something in the past that was decided. So my question now really is moot because the decision was made earlier.
Right.
Is that what you're saying?
I didn't quite follow that, but the language was taken from what had already occurred. So what Robin's committee was considering was what's the criteria for choosing a group as far as, what would be the manner in which it would happen. That was left out by the land use committee when the land use committee was putting forward their recommendation on the land use matter portion of the application.
I understand. So I guess what I'm saying is that's unfortunate because how we identify Soho and this arts community, this sounds as if it was the predominant need was for theater companies to have space, and I'm just observing another loss. But what I see now that decision was made earlier, and that's why it's not my question to Robin is really she was responding to a decision that was made earlier. So I think that's what you're trying to explain.
Right, yes.
Correct. Okay, thanks. Unfortunate, but thank you.
Okay. I think that, all right, so did I miss anybody else? It's the last chance before we move into considering all the resolutions that have been put forward before us. Okay, I don't hear anybody and I don't see anybody stepping up. So what we have before us that we're going to be doing a voice vote, a roll call vote, is a large omnibus bill, which includes 2 resolutions from the Schools and Education Committee, 2 resolutions from the Arts and Institutions Committee that were introduced, 2 resolutions from the Traffic and Transportation Committee, 6 resolutions from the Landmarks Committee, 8 resolutions from the SLA 1 Licensing Committee, 15 resolutions from the SLA 2 Licensing Committee, and 25 resolutions from the Quality of Life Committee. Resolution number 2 in the Quality of Life Committee has been modified, and those are all of the resolutions. And as a matter of, we're going to note before we take the full vote on all the other items that Michael Levine and Cormac Flynn have recused themselves on item number 16 as members of the Board of Directors of Village Alliance, and item number 3 on the SLA Licensing Committee number 2, Rocio Sands is recusing herself as well, as has an interest in the property, and I believe that those are all the items that will be in the omnibus vote that we will be taking now. Is there any objection to voting on these with the specific votes, with the exceptions that I've noted?
No.
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 Okay, so I don't hear. Oh, Anita, there you are. I see you.
My audio is a little odd, so bear with me.
All right, so Valerie, we're ready to have you do a roll call vote. Now, before we do that, I'd just like everybody to stay on with us, and for the other guests that have joined us as well on the Zoom conference. We have a few people going to be asking you after we conclude our business session, after we finish our new business, which will be after this vote. We're going to be going into executive session to discuss a personnel matter. So just before we get there, I'm just going to let everybody know that we'll be going through the list on Zoom and making sure that it's just board members. So if the board members would stick around. Okay, so Valerie, do you want to conduct the roll call vote?
Unmute everyone.
right, ready? Susanna Aaron.
I say yes to all of them.
Thank you. Keen Berger has left early. Carter Booth.
Yes.
Katie Bordenaro.
Yes.
Anita Brandt.
Yes.
Thank you. Amy Brenna.
Yes.
Rich Kakapolo.
Yes.
Thank you. Ritu Chaudhry.
Yes.
Tom Connor. Oral Dawson.
Yes.
Valerie De La Rosa. Yes. Doris Ether. No, she was on earlier. I'll check back in. Robert Ely.
Yes.
Thank you. Mark Fitzgerald.
Yep.
Thanks. Cormac Flynn.
Yes.
Joseph Gallagher.
Yes.
Susan Gammy. Okay. David Gruber.
Yes.
Wayne Kawadler.
Yes.
Thank you. Susan Kent.
Yes.
Janine Kiley.
Yes.
Thank you. Patricia Laria.
Yes.
Michael Levine.
Yes.
Thank you. Janet Liff.
Yes.
Ed Ma.
Yes.
He was on.
Ed, hold on. Let me just hold on, guys. Let me just check for Ed. I don't. Oh, Ed, hold on a second. Ed, you still with us?
Yes, I'm still. Yes.
Okay, you vote
Thank
yes.
you.
All right.
Let me just check on Tom Connor or Doris Deether.
Doris Deether, yes.
Thank you. Just thought I'd double check on people quickly. Susan Gammy, one more time. Okay. Maud Marin. Matthew Metzger.
Yes.
Thank you.
Doris Dieter's home.
Daniel Miller.
Yes.
Thank you. Brian Pape. I see you nodding your head. Yes. Donna Raftery.
Yes.
Thank you. Lois Rakoff. Lois. Okay. Bo Riccobono. Don't believe he's on. Robin Rothstein.
Yes.
Thank you. Sandy Russo.
Yes.
Thank you. Rocio Sands, with the exception of number 3, which you have correct yourself. Scott Sartiano.
Did you get Lois Rakoff as yes?
Lois, I have you now. Thank you.
Good.
Scott Sartiano. Shirley Secunda.
Yes.
Thank you. Kristen Shea.
Yes.
Frederica Siegel.
Yes.
Thank you. Georgia Silvera Siemens.
Yes.
Thank you. Dr. Shirley Smith. Okay. Chenault Spence.
Yes.
Kathy Sullivan. Susan Wittenberg. I see her on there. Check back in a second.
Let me just, Susan, you with us?
I'm with you.
All right, so Susan, yes?
Yes.
Thank you. Antony Wong.
Affirmative.
Thank you. Adam Zeldin.
Yes.
Great. And just going to check one more time for Dr. Shirley Smith.
Yes.
Thank you. All right. And please note that I have noted the number on the SLA 2, quality of life, number 16. I have noted the recusals for the 2 individuals that we named from before, written in my notes. So all set there.
Okay, so I'd say that's a pretty significant turnout. So I really thank you, everybody, for joining us tonight. Now we're going to move on to new business. Does anybody have any new business they'd like to raise? Okay, I'm going to just jump in and say that one of the things that is new business is COVID-19. And we're going to be addressing how we move forward in the coming weeks. We're going to be having weekly executive meetings, and we're going to keep the board updated on that. Does anybody have any questions that they'd like to ask, or any specific concerns? I mean, that are beyond the obvious? Yes.
I'd just like to thank you and Bob and the staff for getting us reprogrammed for the new way of doing things, and your very quick mastering of this not uncomplicated technology.
I second that motion.
I third. I third. Here, here.
I'll tell you, Bob,
Thank you.
Getting up to speed pretty fast.
Good job, Carter. You did a good job.
We were not even subscribers to Zoom until a few hours before our executive committee meeting.
Yes.
Tuesday. So,
hello,
Ed. Yes, I hear you, Ed.
Yeah, Carter, yes. You know, can we next board meeting? Can we invite the Lennox Hill or the Northwell, the clinician, to come and report updating about this virus, please?
Yeah, just so everybody knows I think as we move forward, we're going to try to maybe do some updates in this format, not necessarily committee meetings, but have some of our community partners come in as it seems relevant to have us give some updates. I mean, this is really a good way to at least reach out to us and to the community, and we're going to be shifting gears with the way that we use Zoom as well, to actually have the public participate directly with us in Zoom, as opposed to watching on the live stream. We've had I think up to 25 or 30 people watching the meeting on our YouTube stream, and that would be a little bit more efficient. So yes, we can do that. Are there any other comments?
Carter, will there be committee meetings during the month via Zoom, or is that too soon to ask?
Well, at this point, I think we're going to take a few weeks break for committee meetings, if not even up to a month. We've got a pretty good the way the April falls. You know, if we were to have committee meetings, we would probably do them in the second to last week of April, and have our full board meeting in the last week of April. We would have to figure out how we could do committee meetings with applicants. That's another challenge. It's certainly something we can do, but we need to figure out the technological side of that and how we might move forward. But as long as the city agencies are beginning to put a pause on their actions, there's less of a need, I think, at this point, for us to schedule at this point any committee meetings. Something certainly we'll consider as things come up. You know, we react to applicants, and if people are going to be making applications, we don't want to give up our voice and provide those recommendations. So I hope that answers your question, Michael. Is that?
Well, the question I had is, we had 2 land use review applications before the land use committee, and of course, with that meeting being canceled, I'm wondering if we would reconsider them at a future point, or what would happen there?
That's a good question. Anita, Frederica, and I had a discussion that evening before the meeting, or late afternoon, with respect to the agenda items on our land use committee meeting. There are 2 physical cultural establishments that were renewals, and we felt that, typically we don't ever have any objections on those, and the 3 of us felt that given that these permits had already been in place for 10 years and there are no obvious issues with either of them, that would be the 2 types of applications that we would be willing to not have a committee meeting and allow them to move forward without us providing a recommendation. So that's specific to those 2 items, and that's in fact why we canceled that meeting, is we didn't think it was appropriate to gather the committee together.
Fair enough.
In person to do that. So. Good. And I see Matt Metzger, you've got your hand up.
I was just going to say, I know the membership here is a pretty well-developed social safety net, but if any of the older members need anything, I'm sure myself and the younger members would be happy to go shopping or get people what they need.
Great, thank you, Matthew. And that's something that, you know, I've been sending out emails to the board myself, to the board members directly, and you know, I'm gonna send out another one in the next few days and ask people if it would be okay to have that as an open email discussion amongst all board members. I've been blind copying the members, so if people wanted to be involved in an open discussion, I think that would be a good format. And also, with our weekly executive committee meetings that we're going to be doing, I believe that we're going to be doing them on Tuesday nights at 6:30, which is the normal time that we do our executive meeting. We're going to be doing them via Zoom. And any of the regular board members are certainly welcome to jump in and see where things are and provide suggestions. Of course, you can all text me or email me or to Bob in the, you know, email him, and he can also provide you with his cell phone number as far as you know, anything that comes up. And I think, you know, we're going to figure out ways that we can better keep the community informed of specific issues that are happening from south of 14th Street, north of Canal, west of Bowery and 4th Avenue and to the river. So that's really our world, and we'll try and get as much information as we can out about that area. I see Coral, you've also got your hand up.
Yeah, I mean, I want to thank you and everyone on the board for participating tonight, and I want to encourage us to consider business as usual, because this is the new normal. So in terms of having demonstrated tonight that everyone is participating and able to entertain all the business at hand, we can certainly do committee meetings, and we can certainly do everything that comes before the board. I definitely don't expect any private business or anybody that's actually giving applications to not be able to Zoom. They just have to click on one link. They certainly will participate. And so I would encourage us to continue. Maybe volumes will be down, but certainly we as a community board are here and are serving our purpose. And, you know, I really, it's really impressive that everyone's done this tonight, and it's wonderful. And this is sort of the new way of life. So this is certainly, I don't think we need to really halt anything. And I just would encourage us all to move forward.
Would there be the same link in the future for all meetings, or would there be a different link for every meeting?
It would be a separate link for the different meetings, and we're only at this point able to conduct our meetings in this fashion because of the executive order relaxing the public officers law that Governor Cuomo has put forward. The New York City Charter relies on that state law. And I believe that there is a time frame which limits that. You heard earlier, Senator Hoylman, Brad has a bill that's up for discussion that would make this more of an ongoing situation in times of emergency. And we can continue to do this at this point as long as the governor keeps extending that executive order. So that's what we rely on in order to do this.
Well, I hope we would certainly support a resolution and push forward for this to continue being an option. As being the only woman who was ever pregnant and serving on the board, it's sort of ridiculous that, you know, it's taken this long. So we should have this optionality going forward.
I think, and that's something, you know, with the public officers law, that's at the state level, and that's certainly something that I think Brad has considered. I don't know the exact details of his bill, but I'm sure that Jacob Priley can, if you want to be in touch with him, can tell you a little bit more about that bill.
Yeah, I'm happy to testify in favor and to share my personal experience. I mean, this is the new normal, and it's great that we're on, and we can certainly have guidelines around it, but there's absolutely no reason not to continue it.
Okay, thanks, Coral. And Susanna.
Thank you, Coral. I wanted to just refer to something that we talked about at the beginning of the meeting with Lennox, with the elected officials. Greenwich House is initiating twice weekly calls with its membership, where people on their staff are actually going to call people up at home and check in with them. They're hoping to expand that list a lot. And when they do, there will be a need for volunteers to take on some of those names and make some of those calls. So I just wanted to put that idea in your head. I think it's something that we might all like to participate in. And I think that the best way to get through this crisis is that to make sure that no one feels isolated and alone. And if we can all make that connection with people, we'll go a long way to doing that. There are about 7,000 seniors in our district. We should be able to get in touch with all of them. Thanks.
Thanks, Suzanne. And, and just on that note, I was going to bring this up later, but you've already brought it up. I think that the reality is that we're going to have a lot of people who are sick in our community and around us. That seems to be inevitable. To what extent, we don't know. But one of the things that we can do is we can call people. You can video chat with people. And tonight, it's amazing how much participation that we have. It's almost all of our board members are with us tonight. So it is something that everybody can learn with a little bit of patience and reaching out to people, calling them up. The idea is not to go visit people in person, right? But there are other ways that we can connect with each other, and that's something that people should consider doing. And
also, to that point, also visiting neighbors, which is a small organization, and what they do is outreach to senior citizens, helping them to get to the doctor, helping them to go grocery shopping. Obviously, they can't receive people anymore, but there is a lot of opportunity to volunteer to pick up groceries and necessaries for older people. So if you have any interest in volunteering and helping out on that, it's sort of like you just leave something at the door. You could be an enormous service to someone who feels uncomfortable leaving their house, and that's visiting neighbors. I'm putting in a plug for them too.
Yeah, and I was going to also say that and I see Brad still with us, but one of the other opportunities just for keeping in touch, and we'll start sharing this information as well as it becomes more clear where help is needed. One of the things just to keep in mind is that the information lag it's very important to be up to date on where help is needed. Where help was needed yesterday is not where help is needed tomorrow. And I know that Brad's office has been sending out updates, and as well as our other elected officials. So signing up for their emails as well is a good way to keep on top of things, and we'll be doing the same. But do check when you hear that a need is necessary, verify it and just keep up to date, so that if you've got time, that you're putting it forward in the best way possible on something that any new needs that come up. This is truly every 6 hours, 12 hours, we've got new information, and staying up in front of that is really important. And that's a big part of why I keep pushing the links for the Department of Health, for the city, for the state, and CDC. They update the information. Those are some of the best resources that we have for finding out information, particularly the New York City site. We had a call or an email from a constituent with regards to what happens if somebody in my building gets sick. What do? There are guidelines on there of what buildings can do to clean their hallways, et cetera, and what the best practices are. So that's just an example of the information that's already there. And if you're hearing questions in the media, a lot of times they'll be addressing those just as quickly on those websites as well. And I think that I saw in an email notice earlier from one of the block associations, Lennox Hill Greenwich Village, or excuse me, Lennox Health Greenwich Village, put out a more elaborate set of guidelines on how you can help, what you can do, how you can help somebody who's sick, how do you clean, and just some do's and don'ts. So if we can get an original of that, Bob can email it out to the board. David, I see you've got your hand up as well.
I just want to reinforce Cole Dawson's comments. Even at some point we will pass this crisis, but this is a really good way if we could integrate the public into these meetings and have some way that they can participate and speak. Maybe we don't violate the open meetings law. Maybe it just needs a little tinkering with it so that we all don't have to be in person. But I thought this was very successful. And hats off to you, Carter. I thought you ran a very good meeting. So I think this might be a new standard moving forward for us.
All right. Well, I mean, I just want to keep people in the reality world that we really have to address changing that law at the state level in order to continue to do that. And the only reason we can do this now is because of the emergency executive order.
We will understand that, but let's see what happens. Okay.
All right. And Dr. Smith, I see you've got your hand up. Shirley, you there with us? Okay.
I am. Do you hear me now?
I can hear you now. Yes.
Okay. I just want to say that kudos to you and Valerie, because you really gave me a quick tutorial, and I'm extremely thankful and very happy that I could be on the meeting tonight. So,
right. And I have to say, Valerie has really been incredibly helpful to me in just sort of reaching out to people who are a little not so up to date on their technical skills, but it looks like we worked it through pretty well. And we had a couple of little glitches that I got some emails, but I think for the most part that may have been internet connections, that people didn't have fast enough connections, which is also another real consideration in this as well. While we would normally do it, and these are exceptional times, Brad, do you want to jump in and say anything? I saw that you were still there and your name was mentioned a couple of times.
Sure. Thanks, Carl. Just, I'm so impressed. You know, this was such a good discussion, really seamless and informative and important. There could not be a more important time to engage with our neighbors than now. So, again, I commend everyone for their participation. A lot of good ideas. I know Jacob and I were taking notes, and you know, this is the moment we should seize in terms of bettering our public discourse and improving ways that we can interact and, you know, protect the most vulnerable. So please send the ideas, you know, to me and to all my colleagues in elective office.
Okay, thanks, Brad. And did we have any more comments before we're going to move into executive session to discuss a personnel matter? So, are there any other comments from anybody? Okay, so at this point, I'd like to ask all the non-board members if they would leave the call, and Mark, who's assisting us with streaming, and this would be the point where we would conclude the public portion of our meeting and end our live stream. So thank you for everybody who's been watching via live stream. I know I've gotten a few texts from a few people. I think Darlene's been watching, and Pete and a few other people. So thanks, guys, for joining us in the live stream. And we're going to start going through. Valerie, do you want to help me out and just go down through the list? And
hey, Carter, before you do that.
And Noelle from Beta NYC and Kate have really been a great help to me. So Noelle, yes, go ahead.
Hey, I just want to, now that the live stream is off, I just want to say thank you to all Community Board 2 members. So